Open the committee meeting of Children and Family Law for Tuesday, March 4th. A few announcements before we go to our first hearing. We've all very sadly watched the no longer availability of Girl Scout cookies through Representative Levesque, but there is good news. There is a connection, and it's on the 4th floor. And of course, we want to go up to the 4th floor front desk and buy some Girl Scout cookies, wouldn't you say? So we've fixed that problem. Secondly, for the minority, if you are going to be filing a minority report, it has to be in today. This is something that we were reminded of in Chair's meeting just now. It goes on the green sheet. The statement of, oh, we're still thinking about it, can we be back to you in a few days? The answer is no. If we do not have the desire of a minority report and the person writing it by the time we leave today, there will not be one. The green sheet has to reflect it. There will be no meeting of this committee next Tuesday. We were told as much as possible we should not be meeting next Tuesday because it's town meeting day, and that affects many of us in various ways. You will see on the calendar there are a few committees that are meeting. They have 60 or 70 or 80 bills they're dealing with. So given the choice of our meeting next week and having 80 bills, or our not meeting next week and not having 80 bills, I opted for we're not meeting next week. Our next committee meeting will be in 2 weeks from today, March 18th, and on the agenda of that meeting will be everything that's on our plate before crossover. There will be hearings and executive sessions on HB 518, requiring the Commissioner of DHHS to provide a detailed annual report of all costs incurred by DCYF. And there will be a hearing and executive session on 775, directing DHHS to issue a request for proposals for supervised visitation centers with our own Representative Nelson as prime, Representatives DeSimone and Rice amongst the co-sponsors, and as a co-sponsor our occasional substitute representative and law professor Buzz Schur. We must exec those bills the same day now because crossover looms nigh. Offering also an executive session is 553, which a lot of people have done a lot of work on. Today's acting ranking member, Alicia Gregg, is the prime, and I count 8 additional members of this committee as co-sponsor. A lot of work has been done. Representative acting ranking member, do we have an update on Representative otherwise Deputy ranking member Grossman's son?
Things still pretty much remain the same. So he is still in the PICU at Mass General. So prayers and good thoughts still needed. They are hanging in there. So
got it. Thank you. I'd like to introduce substitutes. Representative, would you tell us who you are, where you're from, and what committee you're usually on before your promotion to us?
Thank you, Mr. Chairman. It's actually a demotion and less work because I'm usually the clerk on Judiciary. I'm Katie Peternell, State Representative for Wolfboro. Thank you.
Do you realize that we have 2 clerks to do the clerk job here? So
I'll take one anytime.
And Representative Gregg, tell us who you brought.
So we have Representative Rosemary Rung. Do you want to introduce yourself?
Sure, thank you. Rosemary Rung. I represent Hillsborough 12, which is the town of Merrimack, and I typically sit on Division 1 of Finance. So this is kind of a nice change. I've never subbed in children and family law, and I'm starting my 4th term.
I won't say which division of finance good bills go to die to. I will say it is not Division 1.
Yeah, it's going to be a brutal year. Yeah.
And thank you for being here. We also have Stephanie Grund. Right, Grund.
Yes. Thank you. Stephanie Grund, and I represent Hillsborough 34, which is Amherst. And I usually sit on municipal and county government, and this is my first term, so it's my first time subbing. So I'm excited to be here, and I just want to say thank you for supporting Girl Scouts. I was a Girl Scout leader for 2 troops, and worked on many events in town as the accounting leader. So
Did you bring a stash with you today?
I have lots of access if you need access.
Okay, 4th floor, front desk, but now we have another connection in
You got
case.
it.
And then one final thing before we begin, I will be appointing a family court subcommittee of this Children and Family Law Committee. 2 years ago, the Speaker of the House asked me to chair a special committee on the Family Division of Circuit Court. 4 members were appointed by me from this committee, and in consultation with me, Chairman Lynn of the Judiciary Committee appointed 5 people from his committee. We took 12 hours of oral testimony, received volumes of written communication, and had numerous meetings of the committee and subcommittees. Because many individuals hold a highly negative view of our courts, I wanted to assure our judicial system leaders that, in general, the way I address issues is collaboratively, not confrontationally, and would act that way with them. That is to say, unless or until I am convinced otherwise, I would be of the belief that our judicial leaders come to work each day to do the best they can, and to be fair and to be hopeful. Of course, there is the occasional bad judge, just as the occasional bad apple is to be found in every profession. But my offer to the judicial leaders that I wish my special committee to gang up with them against problems and not to gang up against them, they were of the same opinion. Our 2 years of work proved this to be true. We started with low-hanging fruit. Several items that were easy to work on. While they were not major systemic issues, they were hardly Band-Aids. The special committee honored their knowledge of working in the field every day, while they honored our position as people approaching things with outside pairs of eyes. Good work was done, but we knew there was much more to do. With a level of mutual trust having been established, my hope was that the Speaker would reauthorize the special committee for 2 more years so we could focus on tougher issues. Several of us saw 3 issues, among others. Number 1 was the level of ability of those offering pretrial counseling. Speaking only for myself, having spent 50 years giving pastoral counseling, I got the impression that the quality of pretrial counseling could be improved. Secondly, we noted the wide variety from court to court of what would and what would not be admitted as evidence. It is a stated policy that the rules of evidence in family division are at the total discretion of the judge. Because the superior court operates on a different principle, the quick answer might be to move everything from the family division there. But we are aware of other issues that would then come into play. Therefore, further work, considerable further work is needed. And then 3, issues of domestic violence and how they are treated by the family division need scrutiny. We noted a lack of communication between the courts hearing a case of such violence and with a different court hearing matters of divorce and custody. With these matters still outstanding, some months ago, I asked the Speaker to give the special committee 2 more years. Since the conclusion of our special committee's first 2 years last October, other state representatives have weighed in on these matters, some with bills of their own. The Speaker's response instead was to suggest I form a subcommittee out of this Children and Family Law Committee that would work in some depth on the more difficult issues perceived. Children and Family Law Subcommittee on the Family Division of Circuit Court of the State of New Hampshire is hereby appointed. In consultation with the Honorable Peter Petrino, Ranking Member, I appoint a subcommittee under my chairmanship consisting of myself as its chair, Vice Chairman Deborah D. Simone, Representative and Family Law Attorney Jay Markell, former Chairman of this committee Kimberly Rice, Acting Deputy Ranking Member Alicia Gregg, Representative Heather Raymond, and Representative Jody Nelson. I will be co-opting as regular consultants a few present and past House members who, by their training and experience, will bring expertise to our work. We will work thoroughly and not make haste. However, should any aspect of our work conclude by the end of October, we may file bills of sufficient depth and quality to make major changes worthy of our judicial system and of the state of New Hampshire. So consider this now appointed.
Thank you, Mr. Chairman.
Welcome. Open the hearing on House Bill 493, requiring education on child abuse and neglect for certain healthcare providers as a condition for licensure, and the chair recognizes Representative Gregg.
Thank you, Chairman and Committee. For the record, my name is Alicia Gregg. I represent Nashua in Ward 7 specifically. I'm going to be doing this for Representative Grossman today in her stead since she cannot be here with us. She does send her regards to everyone. This bill is similar to one that we looked at last year. What this is doing is, and by the way, we have a lot of different bills, I think partly because of the special committee we worked on and because of the intense work that we have done in the last 2 years, really kind of tackling our biggest problems all in different directions. And this is actually part of that. So what this does is this is talking about training for licensure for physicians, and it's specific, and also for nurse practitioners and physicians assistants. This is specific to child abuse and neglect. So training. You know, this is important, and I do have an amendment too that changes it from 2 hours of education to 1 hour of education. I think we can all agree that 1 hour is goes pretty quickly. So it's not a lot of time, but it's enough. I think it's important that we are educating people who see this the most, not only so that they can understand what child abuse is, but also what child abuse is not. You know, we have heard a lot in here, not only about child abuse cases getting missed, we also hear about maybe people being accused of child abuse that it's not. So I think that the only way we can really prevent both of those and help both of those is to really educate. I know other states even have requirements, believe it or not, for beauticians, for estheticians, because they're more likely to have somebody in their chair. I can't imagine somebody more apt to see abuse than any of these professions. So we do have some people willing to testify. I also would like you to look, Dr. Roy said could not be here. She said that she was going to submit some testimony, but there are other people that can talk more to the specifics. But I can answer any questions that you might have, maybe.
Any questions for the representative? Representative Markell.
Yes, thank you for taking my question.
A little closer to the mic, please,
Oh, I'm
sir.
sorry. Okay, is that better? Okay,
I
thanks.
can hear you.
Closer.
Okay, a question. Okay,
Sure.
with the hour that you've mentioned now, is this going to be 1 hour to complete the requirement, or is this going to be an ongoing 1 hour each reporting period?
So this is like many other we see in medical professions with new training, continuing education. This is going to be for new licensure or continued licensure. So not every year, but certainly when you need to renew your license.
Okay, but, okay, so if I'm hearing...
Follow up?
Oh, I'm sorry, follow up. Thank you, Mr. Chairman. So would this be 1 hour, one and done, and that's it, or every year?
Well, not every year. If you have continued license, when you get your license, when you have that renewal,
Right.
then that's what it looks like to me, that it would be an extra
Okay, thank you.
another hour.
The chair has a question. Since I'm married to a physician and since I'm part-time CEO of a medical organization, this does pop up periodically, called continuing education. Would this be one of the hours that this professional would be required to do in that re-up year, or would this be on top of?
I'm going to defer that question because I'm not sure and I want to make sure you have accurate information.
Thank you.
Thank you.
Anything else? Come on back.
All right, thank you.
Chair recognizes Ben Bradley from the New Hampshire Hospital Association.
Good morning, Mr. Chairman and members of the committee. For the record, my name's Ben Bradley. I represent all of the state's 26 acute care hospitals and specialty hospitals in New Hampshire through the New Hampshire Hospital Association. Hospitals and our providers do take their obligation to report any suspicion of child abuse or neglect very seriously. New Hampshire law requires any person who suspects that a child under the age of 18 has been abused or neglected must report that suspicion immediately to DCYF under RSA 169-C:29 through 31. We agree that healthcare providers are in a unique position to identify children who have been abused or neglected and support and promote the programs that our members and others offer to help educate providers on reporting child abuse and neglect. However, we do not believe the education requirements proposed in HB 493 should be legislated. Healthcare professionals already have a duty to report as part of their professional obligations to follow state and federal regulations, which includes many other requirements such as their duty to report elder abuse, dog bites, and communicable diseases. Singling out one type of required training for mandatory reporting seems to create inconsistencies that inserts the legislature in educational mandates that do not exist anywhere else in statute. Historically, the legislature has passed educational requirements for opioid prescribing several years ago. However, those statutory requirements have since been repealed and left to the Board of Medicine to determine. For these reasons, the Hospital Association is respectfully unable to support this bill. I do want to thank you for the opportunity to share our feedback. I also want to thank the proponents of this bill because we have worked with them in the past on raising awareness about the educational opportunities that they support, particularly the Office of Child Advocate, which does an incredible job for the children in New Hampshire. We have worked collaboratively with the proponents of this bill and welcomed them to our Chief Nursing Officer professional peer group to share their thoughts on the importance of child abuse and neglect reporting training. And that information was very well received by our members. So I'm happy to take questions from the committee.
Mr. Bradley, would it be your observation that many of the providers in the hospital system are really ignorant of the signs of abuse and neglect, that they really have never been much taught this, and that no one else in the facility would catch it either unless this bill were to pass?
I can't speak to that, Mr. Chairman. That's not my sense. I think our members do provide training to the professionals that are outlined in this bill. We've also, as I mentioned, welcomed those proponents of this bill to our peer groups through the Hospital Association to share the resources that they're promoting, to try to get our members to adopt that, which I think that information, as I've mentioned, was well received.
Any questions for Mr. Bradley? Representative Raymond.
Thank you, Mr. Chairman, and thank you, Mr. Bradley, for taking my question. So this is the second time that this bill has come up in the last couple of years. And last time, the discussion was about not training how to call or when to call. It's not mandated reporting training. It's training about how to recognize the signs and symptoms of abuse. In the 2 years since the last time this bill has come up, has the Hospital Association adopted voluntarily any additional signs of child abuse and maltreatment training for their staff?
Well, first, I would just say, yes, I acknowledge that this bill has come up before. As far as our training, our members do provide annual training to their staff on child abuse and neglect, identifying and reporting, both of those. And as I've mentioned, we've welcomed the proponents of this bill to join with the professional peer groups that we host, including chief nursing officers at our member facilities, to share the resources that they're promoting. It's not a question of whether training is appropriate or whether they should be aware of the importance of that training or how to train or how to report. We believe that is very important, which our members do stand behind. It's the question of whether to put something in statute that doesn't exist for anything else. For example, would you promote training and reporting on human trafficking? Would you promote training and reporting on elderly abuse, other things that are an expectation of the providers that work within our system? And so we do believe that those are important trainings. It's just a question of whether to mandate it through legislative statute.
Representative Petronell.
Thank you, Mr. Chair, and thank you for taking my question. I am vaguely familiar with the requirements of physician continuing medical education training because I actually help keep track of my own husband's training. And I know that they're required to complete 100 hours of continuing education every 2 years. And it would be my assumption that any physician who was taking care of children or minors under the age of 18 would probably be already alerted for or on the alert of child abuse and neglect. I mean, if anybody who's taken their child to a pediatrician knows that they're asked questions, their child being examined. They might even ask the parents to leave the room. So I personally find this to be a little bit of overstep and a bit of an undermining of physicians' professional standards. Would you be in agreement with that?
I would just echo
Was that
what
a
I've-
would you believe?
It is kind of a would you believe, yes.
Just say it for the record. Would you believe everything
Would you believe
she just
that?
said?
I would just echo what I've reflect in my testimony. Thank you.
Mr. Bradley, in the unlikely event a professional at one of the hospitals you represent should miss this sign, as it's unlikely with any other thing that occasionally is missed, would there not be other team members who would catch it?
I don't think there are any guarantees whether you've taken the training or not. I think our professionals make every effort to, support their patients. I think they act in good faith. And I, am just here to try to represent their voice as folks who come to work every day and do their best in a very challenging environment.
My follow-up to that is it unlikely that if somebody is admitted to one of the hospitals you represent, that person would be seen by one medical professional only and no other staff?
Respectfully, Mr. Chairman, I don't know the answer to that. I could speak hypothetically from, my experience and going to a doctor. There are typically at least a couple of folks who will visit on a visit.
Okay. Any other questions for Mr. Bradley? Seeing none, thank you for your testimony. And I neglected to mention this at the beginning, couple of things for the new folks. I prefer Mr. Chairman, not Mr. Chair. Others may make other decisions as people do with pronouns. Also, some committee chairs really expect their seat fillers to keep quiet until it's time to vote. I'm not one of those. I'm glad you're here. I want you to speak up. Even if you're just passing through town, raise your hand and be prepared to be called on. I welcome you to our group. Next, Chair recognizes Cassandra Sanchez from the New Hampshire Office of the Child Advocate. Welcome back.
Good morning, Mr. Chairman and members of the committee. And for the record, my name is Cassandra Sanchez. I am the child advocate for the state of New Hampshire. I am here this morning in support of House Bill 493, as well as the amendment that was presented this morning. So I'm going to start by laying some groundwork as to how the Office of the Child Advocate became invested in this training. In early 2020, we identified 9 cases of non-ambulatory infants that presented to emergency departments with multiple broken bones. In that time frame, thankfully, none of those children passed, but there were a large number of them that had seen multiple doctors before getting to the point of getting the appropriate medical attention that alerted that the cause of the injuries were ultimately a result of abuse or neglect. We ultimately decided, because there was such a large number of those in a short period of time, and we're talking about infants that can't speak up for themselves, that it was really critical for us to take a look at this issue and try to identify some gaps that led us there. In August of 2023, the OCA hosted a system review mapping, which allows us to look at the larger system issues and try to identify areas of growth. During that system review mapping, we had members of law enforcement, medical professionals, specifically medical professionals that had an expertise in child abuse and neglect cases, including the CAP doctor for the state. And we also had present at that mapping members of the Department for Children, Youth, and Families, and additional members of the community that they provide services to families. During that mapping, one of the identified gaps was trainings for doctors, because we were talking about some cases that included a child presenting to the emergency department first and an emergency doctor not noting it as abuse or neglect and having to be seen by a second level doctor for that finding to occur. We recognized that there were some misses at the emergency department level, as well as one of these children was seen by their pediatrician initially and wasn't brought back to the ED until days later when they continued with fussiness in the home. Those were misses. Those children returned back to that family environment until they were seen by another professional. And so in talking with these professionals, we said, what can we do to ensure these misses do not continue? Again, these were just non-ambulatory infants. This doesn't mean that there weren't other misses that were happening with older children, maybe toddlers who are mobile and would present to an ED with bruising. And there are areas of abnormal bruising. There are areas of normal bruising for toddlers, especially when they're mobile moving around. So how many more misses were out there? We do not know, and we don't have a way to gather that information. But what we know is that we do not want to continue to move in that direction. We want to ensure appropriate education to keep that from happening in the future. So we met with and joined in the efforts with the bill last session, which did not move forward. Then over last summer, so summer of 2024, we created a presentation, myself along with the medical doctors, about what we observed, about the cases that the OCA observed, about additional cases that they have observed, including pictures of injuries that were presented to emergency departments or other doctors before they made their way to a professional in child abuse. And it shows the extensive amount of visits that occurred for some children, some of which are now left with lifelong injuries and lifelong disabilities because of what occurred to them, what occurred for them early in their lives, and because medical treatment was not sought right away and they were not placed in a safer environment and continued to get additional abuse within the home that they resided. So we worked together to present that. Those were presented to multiple boards and professional associations, all of which I will say, I don't believe there was one person in any of those rooms without their jaw wide open when they received this presentation and learned what some of the children in our state have experienced. And many felt very strongly that this was an appropriate ask. It is not addition to the hours that they already have. It is taking one of the hours that they are required for training to be allotted for the child abuse and neglect training. It was the intention of this training is to ensure that they are seeking out the signs and the symptoms of abuse and are referring to the appropriate entities to further investigate, such as the CAP team, such as our child advocacy centers for interviews if it is older children, ensuring that the appropriate professionals are involved to provide that more in-depth review. The course was completed. It is an online course. It's initially a 2-hour course. It was presented. It's been out there and available for 5 months now. In that 5-month period, 59 professionals from the target population, so that's physicians, physician's assistants, APRNs, 59 have taken it on their own. That is not a representation of the professionals across the state. So allowing it on a voluntary basis is not bringing in the amount of completion that we would hope for at this point. RNs have voluntarily signed up for the course, and there are 87 RNs that have completed the course up to this point. So we actually have more nurses that have completed it than the medical professionals that we are seeking to have complete this course. So at this point, from my perspective and the work that we've done in the office, as well as what I've learned from the medical professionals, some of which we'll speak today, is that this gap remains. And this is a real critical gap for us to close. It is not a large ask. They are already conducting this training to make sure that 1 hour is allotted to abuse or neglect can protect far more children than the amount of hours that it's going to take away from our physicians. I am open to any questions.
I heard you say that this is not additional time, but it is part of their hours. I do not see that reflected in either the bill or the amendment. So if we were to pass the bill or the bill is amended, your statement is aspirational, but it's not a requirement. It could be added on. It just doesn't say.
Thank you for that comment. I had some in-depth conversations with the folks that developed it, and I know that was their intention behind it. So that I'm speaking on that was their intent of bringing this bill forward, was to have it be one of the already allotted hours for training.
This bill is scheduled to be exec, and I could exec it right after this hearing. I must exec it later this afternoon. I'm going to defer until later this afternoon to see if an amendment could be brought forth that would put into law, if the bill passes, what you mentioned, because I think that would be helpful for some of us who watch their spouses have to do 100 hours every other year. Yes. Any other questions for Ms. Sanchez? Yes, Representative Love.
Thank you, Mr. Chairman. Thank you for taking my question. You mentioned the voluntary course was a 2-hour course. Do you think we might be skimping a little bit by knocking it down to 1 hour with the amendment? I'd rather have 15 minutes left over of people twiddling their thumbs than missing anything.
I will defer to the doctors to answer that question for you, but my understanding and the way it was explained to me is that in parsing it down, the core critical information was still included, and they felt that it was still substantial enough, but I will let them further answer that.
Thank you.
Thank you.
Representative Nelson.
Thank you, Mr. Chairman, and thank you for taking my question. I do know that, and many of us know that you had come from Massachusetts. Massachusetts does have this requirement in statute. Have you seen, had you, while you were in Massachusetts doing your job there, seen any difficulty in medical professionals fulfilling this requirement?
I did not see any difficulty with medical professionals fulfilling that requirement. And I saw some wonderful relationships with local hospitals and pediatricians with the Child Welfare Agency, and ensuring that they had really open communication and an understanding of each other's roles and signs to look out for.
Follow up to her question, were these, was this continuing education unit mandated by law, or was it done by the professional agencies?
It is mandated by law.
By law, thank you. Any other questions? Representative Peternell.
Yes, thank you, Mr. Chairman, and I will try to ask a real question this time. My question, Massachusetts does have a lot of exceptional requirements for physicians, so much so that the license is almost burdensome to maintain. My question is regarding the actual section of law. Do you think this would be better under 329-16G, where they see it continuing medical education is required for physicians, rather than in 169C?
I could not tell you which I believe would be the better fit. I just think it's critical that we do have it in our state laws here.
Representative Love.
Thank you, Mr. Chairman. Thank you for taking my question again. Do you know if DCYF investigators are required to take a course like this?
DCYF investigators have extensive amount of training that they have to take. They have training when they're onboarding, as well as extensive ongoing training. Some of that is offered to them by medical professionals. They contract with the CAP program and the doctors there, and so they have regular information sharing between them. They have offered trainings, extensive, not in this sense, because this is more focused to medical professionals, but in more coming from a psychology, social work standpoint, ensuring that they do know signs and symptoms to look out for, that they do know when certain disclosures are made by children that they have to reach out to certain entities. They also work very closely with our child advocacy centers, the CACs here in New Hampshire, and they also offer specialized training to DCYF staff. So they have a lot and much more hours than what we're asking here for our medical professionals.
Seeing no further questions, thank you so much for your testimony. The
Thank
chair
you.
recognizes Dr. Michael Matos from Wolfboro Pediatrics. And he has written testimony, apparently not enough for the committee. You say 12 copies here?
All right, thank you, Mr. Chairman. And committee members, I am Mike Matos. I am a general pediatrician at Wolfboro Pediatrics. And I'm here today in support of the bill, and I have 3 points that I wanted to bring forward to the committee. First of all, I think that physicians of all specialties who treat pediatric patients need this kind of child abuse training. As part of my job at my hospital, I do receive a lot of the emergency room notes for patients who are seen as children, even for those patients who I don't personally see in my practice. And one such note came through recently, which is representative of my concern. So a 7-year-old boy presented to the emergency department with his father for complaint of headache. And the reason he had a headache was because that day his stepfather had hit him several times in the head in anger. The emergency department physician appropriately noted all the physical findings, noted that the child had a normal neurological exam, but at the end of the note it just said, "This patient does not have a concussion." There was no discussion about whether or not that patient needed to be safely placed with his father until the safety and the presence of the stepfather could be verified. And there was no mention of DCYF being contacted. And to answer your earlier question about other team members, no one from the team that day called DCYF. So that brings me to my second point, which is nobody goes to work and says, "I want to do a bad job." There's a saying that I've learned in medicine that says, you don't rise to the occasion, you fall back on your training. That lack of training prevents a lot of physicians from wanting to be involved with one of these cases. They hand it off as soon as they possibly can because they don't want to make an error. They don't want to do something that harms the child, and they don't want to do something that might perhaps interfere with prosecution of a perpetrator. So needing that training brings me to my third point, which is the proposed coursework burden, which is intended to be part of that 100 hours, by the way, is not excessive. So about 10 years ago, New Hampshire required that all physicians do the 3 hours of training every 2 years, learning about pain medication and opioid addiction treatment. That year, I signed up very quickly because I wanted to satisfy that need in my community. And I treated 2 patients who were in their 20s who did have opioid addiction. They aged out of my practice. Since then, I haven't had a single patient who has needed treatment for opioid addiction, but I continued to do my hours of training every 2 years because that was what was required for licensure in order for me to do a good job. I'll just finish by saying that physicians do a lot of training and travel to conferences to do 1 hour of training for things that they might see once in their career or for things that are 1 in a million. Child abuse is very common, and it's something that, whether they know it or not, physicians are running into on a regular basis if they treat children. With 1 hour of training, I expect that physicians will be shown how to recognize child abuse, how to triage it to the appropriate agencies that will help them. And that's what we really need in place. And that's why I support the bill. I'll take any other questions.
Any questions for Dr. Matos? Representative Love?
Thank you, Mr. Chairman. Thanks for taking my question. In your professional opinion, is 1 hour enough?
Again, I think child abuse is very common. It's fairly complex. That's why there are child abuse experts. But I think, again, giving physicians the tools, saying this is what child abuse looks like, and this is what you should do when you run into a case like this. That's, again, giving them the tools to do these things will make them more assured when they meet a patient who might have some child abuse, rather than trying to bury it under the rug and maybe dish it off to someone else.
Representative DeSimone.
Thank you, Mr. Chairman, and thank you for taking my question. It's kind of a two-part question. Do you believe that most physicians and medical staff are aware that they are mandated reporters, and the fact that they don't always report is because they're rushed?
So I've taken the course. Part of the course explains just what you asked, that everyone in New Hampshire is a mandated reporter. We actually, after this case came through my hospital, we reminded everyone that we are all mandated reporters. Part of the training deals with the actual reporting, and I think, like I said, that's part of the toolbox that people need in order to successfully treat these cases.
Follow-up or second question?
Second part of the question.
Follow-up to the first question.
Thank you, Mr. Chairman, and thank you again. Do you believe that this training will remind more often that these mandated reporters shall report suspected abuse and neglect rather than feel rushed and move on to the next patient?
Well, I don't think the rushing is part of it. Like I said earlier, I think it's the discomfort with wanting to do the wrong thing, not complete the note in such a way that it's going to support the child. That's what I see more often than I was too busy to report it. And the interesting thing is the physician who sees the patient doesn't have to be the one to do the report. That can go to another member of the team. So it isn't necessarily a burden. And again, the course, as I saw it, went through how to do a report. And I think that's very helpful for physicians to know.
Thank you.
Second question. You're all set? You're welcome. Representative Corzine.
Thank you, Mr. Chairman, and thank you for answering my question. From listening to the story about the 7-year-old who came in, it sounds like that physician didn't necessarily need an education on the signs and symptoms, but on his responsibility as a physician. If I may follow up to that, is there any accountability to physicians who just don't want to report it because they don't want to get involved? Because they're putting a child at risk.
Yes, that is part of a law that exists, I believe. And part of the reporting law says that you are not responsible for mistakenly making a report. And so, yes, that was part of the training to explain that sort of subtlety. But I agree, you want physicians to feel comfortable doing the reports. And as you said, it was clear from the note that the physician recognized what the situation was, but just didn't take that next step, didn't realize that you really do have to contact DCYF in those cases. It seems obvious, but a lot of these things do in retrospect.
Representative Grund.
Thank you, Mr. Chairman, and thank you for taking my question. Is the assumption of training being done the same as the requirement in knowing it is getting done? And the reason I'm asking is, can you believe that pediatric doctors, nurses, PAs, LPNs are probably receiving training, considering they work with children, but emergency room doctors, urgent care doctors, maybe even just general family care may not?
Yeah, exactly. So you do have that 100 hours where you can choose what you want to study. I think that, as I said, we study a lot of things as physicians that we may never see in our practice at all. There's 1 in a million things, and yet we know exactly how to do that workup and treat that patient. And yet child abuse is so much more common. And so I think it's very reasonable to say this should be part of your biannual training to understand the subject. And it's not an in-depth understanding. You don't have to deal with those subtle cases where is it abuse or is it not. You at least have to know how to get the child to someone who does know that material.
Seeing no further questions, thank you, Doctor.
Thank you very much.
Chair recognizes Dr. Gwendolyn Gladstone, New Hampshire chapter of the American Academy of Pediatric, those people, little people. And would you believe I have a granddaughter named Gwendolyn? And would you turn your mic on, please?
Mr. Chairman, members of the committee, thank you for letting me speak today. My name is Gwendolyn Gladstone. I am a retired child abuse pediatrician, and I'm here to help explain to you why we need to have this bill. What's different about educating providers about child abuse and neglect is that many of us haven't had very comprehensive training, and therefore, when kids come in with minor signs or symptoms that they're being mistreated, that can be missed and the child returned to an environment where they're further injured. That, of course, is a travesty. It's also not acceptable if a child is mistakenly thought to have been abused, but in fact has some other medical condition. And an investigation is done of the family, and maybe even the child is placed outside of the family as part of an evaluation. We don't want that to happen either. You might be surprised to hear that when children are referred to a child abuse specialist because of concerns of abuse, that abuse is actually diagnosed less than half the time. So a lot of the reason to improve the education for our providers is to be sure we're calling it right. Calling the abuse when it's there and not over-calling it when it's not there. In addition, Dr. Matos has talked about the impact of providers wanting to do the right thing. So what's different here about child abuse from any other medical topic that we don't have laws requiring education? The difference is the number of cases that we see in the field of children who are missed and who are not reported, and because of the long-term effects on even one child. The cost of one brain-damaged child from abusive head trauma is in the order of millions of dollars. So we just can't have that. Many states have adopted requirements for this as a condition for licensure, and almost always it's because there was some incredibly terrible public catastrophe. So, for example, in New York, they made a requirement for education on these topics when a 6-year-old was severely neglected, raped, and murdered. Pennsylvania passed its law, which is 3 hours for licensure and 2 hours to renew after the Sandusky affair. Maine has a requirement because of a child who died, who presented multiple times with signs of abuse, and there was no intervention done. So because the cases that we're seeing, that's why we need to do this. You mentioned providers need to know they have to report. They do know they have to report, but they don't. And the reasons are they're not sure. They don't know how to answer the question of, is this abuse or not? They don't know where to go for help. They don't know how to do an evaluation to look for other signs, hidden signs. They don't want to get involved because they don't know how to talk to a family about their concerns about abuse and neglect. These are all topics that are covered in the 2-hour course that we have available, and which, as Ms. Sanchez has told you, people are not taking. There are thousands of providers that get emails every month reminding them of this course, and 59 have signed up. So those are the reasons why we need to have this mandated. Thank you for listening. I'm happy to take questions.
Any questions for the doctor, Representative Love?
Thank you, Mr. Chairman. Thank you for your testimony. Thank you for taking my question. Child abuse is a pretty complex thing, as you've described there. Do you think 1 hour is enough? I don't, but do you think? And you mentioned 2 hours.
Yes, we currently have a course that's 2 hours long and meets the requirements of a former proposed bill which did not pass. It covers the topics of recognition, reporting, and working with the child protection system. We felt that that course was more comprehensive than would be necessary for example, an orthopedist who might see children occasionally. My husband's a retired cardiologist. He saw adults, but every once in a while a 17-year-old would come through his office. He would have to take this kind of training. And the material that's in the 2-hour course is more comprehensive than people in those kinds of roles really need to have. We believe it can be safely lowered to 1 hour. So the requirement may be 1 hour, but we'll still keep the 2-hour course available. So people, and particularly in primary care, hospital medicine, emergency medicine, if they want to take the 2-hour course, there it is. It's free. They get their free continuing education credits. But 1 hour is sufficient for many people who only see children occasionally.
Thank you.
Any further questions for the doctor? Representative Wrong.
Thank you, Mr. Chairman, and thank you for taking my question. You mentioned some of the states that have this requirement. Do you know how many total in the United States have it?
How many states?
Yes.
Well, I'm aware of Iowa, New York, Pennsylvania, Maine, Delaware. Off the top of my head, those are the ones I can think of.
Seeing no further questions, thank you, Doctor, for your testimony. You say you have written copies, a few.
I have a copy of my testimony, also from Dr. Oral, who's the former head of the child abuse program, and from another provider in the child abuse program.
Would you be so kind as to give them to my committee researcher, who at your convenience make enough copies for everybody else, including we don't have enough of Dr. Matos's testimony, so if somebody would hand her a copy of his. So while she's up at the 4th floor at some point, that one is coming up. His is. Okay, good. Thank you. Well, Dr. Matos was shy about 7 or 8, and Dr. Gladstone about 15. Okay? Welcome. Chair recognizes Betty Gay. The Honorable Betty Gay, served your time.
Thank you. Thank you, Mr. Chairman, and thank you for hearing this really sensitive issue. I can just add to the professionals my views as a person watching people who may be reluctant to report something that they're not sure about. The question, the real serious question that came up last year was, is this going to add to the 2 hours or 1 hour to the training that medical personnel have to come? Well, anybody who has to accrue hours is going to make sure that whatever course they sign up is approved by that agency that's counting the hours. So we already know that there are professional courses right now available, and they are approved for this purpose. So we don't have to worry that we're adding extra burden to the professionals to take the class. Refreshing information, knowledge is never a bad idea. If you've got to take 100 hours and 50 are really very, very rated, very important, it never hurts to be refreshed on things that you studied before, but there's always the chance that there's new information that has been identified. So it's never going to hurt to be refreshed. And the issue that the man who represents hospitals was saying, some of us were nodding our heads as he was saying, well, why mandate this when we have so many other reportable issues? Well, sure, go ahead and mandate it. If it's happening a lot and people are getting hurt, that's okay. But that's not an argument against something that we know exists, sadly exists a lot. In the last 2 days, I had the most unsettling experience because I usually don't have to think about child abuse. But in 2 days, yesterday I got called by a mother whose children she's watched being hurt. She's been hurt and is struggling, who really appreciates Miss Sanchez's organization, who has been helpful, but her children are severely autistic and reacting from being hurt. And one of the problems they have are broken bones from being thrown against a wall or even against a bed that was so hard it broke the bed. Then the day before, I'm talking with friends celebrating a birthday, and the subject of her husband, who is deceased, as an adult, undergoing treatment for cancer, he was x-rayed. And the doctor looking at those x-rays said, "Did you play football?" And he said, "No." He says, "Any contact sports?" "No." He has so many broken bones in his body, and he forgot why he had them. This is a common thing for a child who's been abused. They suppress the memories. So they went home and called his sister, who's a few years older, and said, "Oh, yes, our father threw you against the wall all the time." Child abuse exists. It's ugly. It's horrible. It's left me shaking. I'm gradually getting over the impact of just hearing about this, but it happens all the time, and we need to take the steps to make sure it gets recognized, and this bill, of course, is going to remind them how to report. So please pass this. We're not adding to the burden, but we're going to reveal and help children who are being abused.
Thank you, former Representative Gay. Does anyone have any questions for her? Thank you.
Thank you.
The chair would like to call back Dr. Gladstone for a question. You cited numbers of people who have taken your course, the course that I assume the New Hampshire chapter has generated.
Yes.
Are there other courses that deal with the same material that other physicians may have taken on this subject?
I don't believe so. And the reason is that particularly mentioned in this course is how the child protection system in New Hampshire works. So there are plenty of national courses on child abuse and neglect, but they're not state specific. Most physicians get their training outside of New Hampshire and then come to our state to practice. And as a result, they're not familiar with our laws. And part of the reason to have a course like this is to explain how New Hampshire defines physical abuse, emotional abuse, sexual abuse, and so forth. And that's why I don't believe there are other courses at the present time. There certainly could be. That's why the bill says that if there is another course like that, as long as it covers these topics as determined by the New Hampshire chapter of the American Academy of Pediatrics, it would fulfill the requirements.
My follow-up is certainly if a requirement in your mind is that they're educated in the laws of New Hampshire, I would doubt that taking a course that comes from elsewhere, you would ever recognize anyone else other than your own course.
I'm sorry?
I'll rephrase my question. If other places have courses on the recognition of child abuse and neglect, but they do not mention specific New Hampshire things, when the bill says that credited for a course that is recognized by the New Hampshire chapter of the Academy of Pediatrics, you wouldn't recognize those other courses because, in your opinion, they don't deal with New Hampshire issues?
That's correct. It's important that providers know specifically how to work with a system in New Hampshire.
So no one else would be recognized other than your own course?
They would if they included that.
If they included New Hampshire things?
Correct.
Okay. Thank you so much. Chair recognizes attorney, I think it's Nicholas Fry. And, you know, I thought you were representing OPEC, but then I realized you wrote in lowercase letters, so you're really OPLC, right?
That is correct, Mr. Chair.
And have you replaced Attorney Oosterhuis?
I have, correct.
Okay, thank you. I'll change my phone.
Sure.
Okay.
Well, actually, I took his landline, so if you have his landline, I'll have the same number that he had previously.
I'll change just the name.
Okay.
Thank you, Councilor. Proceed.
Well, thank you all for having me. I appreciate it. We don't take any position on this bill. I just reviewed the language in the statute, and we had some concerns about how we would operationalize it if it did go through. So I wanted to raise those concerns with you, so you're aware of them. So the bill, as currently written, seeks to require those who are licensed as a physician, physician's assistant, or nurse practitioner, and treats patients under age 18 to take certain education requirements. As the statute kind of says, we license individuals to practice as a physician assistant, a nurse practitioner. We don't license people to practice as a pediatrician or to work with people who are under the age of 18. So because of that, we don't collect data on specialty areas for doctors or nurse practitioners or physician's assistant. And your license, when you get it, right, is a license to practice as a physician or physician assistant or as a nurse practitioner. So even during your 2-year term, right, we've heard a couple of people talk about the 2-year renewal cycle that you have. You could technically practice in multiple areas with your license because there's no restriction on that. So the issue there then is that we have concerns about how we'd be able to operationalize the bill as currently written because we're not tracking who is a pediatrician and who works with children under 18.
I think this is a very important point that we all need to hear. Back up about a sentence and a half, please.
Sure. Yep. So because we license physicians and we license physician's assistants and we license nurse practitioners, and everybody has a specialty, right? We all know that in medical practice, but that's not what we're licensing. We don't really have that data. So for us to operationalize the bill as currently written, where it's so specific to treating patients under the age of 18 to take certain requirements, we don't really have the ability to do that. It would be an honor system essentially, right? Someone would take the course because they think it's the right thing to do. And I don't know whether if someone's if you're in a primary care physician and you take on a patient that's under 18 and maybe you didn't expect to do that, we have no way to track that because you have a physician's license. You don't have a license to treat someone under the age of 18.
Any questions specifically on that point? Representative Raymond, by a nose.
Thank you, Mr. Chairman. And thank you, Attorney Fry, for taking my question. So it sounds like that would mean that this requirement to take the training would apply to everybody on the list, regardless of what specialty area they practice in. So someone working at a nursing home as a physician assistant would also have to take this training.
So as currently written, that's not the way I'm reading it, but
based on your ability to track it, right? You wouldn't be able to
correct, right?
Opt people out.
Yes.
You would ask everyone to just do it.
Correct. We wouldn't have that data, and even if we had that data, right, you have a license to practice as a physician or a nurse practitioner or a physician's assistant. So maybe today you're working as a pediatrician, I don't know, right? And then you decide you want to change your specialty. We don't have any way to track that during a 2-year period because they've been giving a license to practice as a physician.
Thank you. Follow up. No follow up. I'm good.
Ready to go? You had a question? Ready to go?
Oh, I'm sorry.
Finishing second today
Sorry.
is Representative Nelson.
Sorry about
You're
that. Thank you, Mr. Chairman, and thank you for taking my question. Would you have a suggestion on how we could rewrite this bill as an amendment to solve that problem?
So our office, we try to be very concerned with not inserting ourselves in legislating. I'm happy to tell you what the concern is. So the concern is that the requirement is for folks that are under treating patients that are under the age of 18. And so we don't have a license type that really fits that, right? You have a generic physician's license, you have a generic, it's kind of an all or nothing, right? I don't know if that helps answer your question a little bit.
Any further questions? Representative Rung.
Thank you, Mr. Chairman, and thank you for taking my question. So currently, New Hampshire has a minimum amount of hours that are required for licensure or renewal. How many of those hours are currently mandated to have training in a specific area?
Well, it depends on what board you're looking at. So, for instance, medicine, I'm just pulling up their continuing education rule right now, but they have different categories. They have category 1, category 2, and then they have to be, I'm looking at category 1, it says the courses shall be courses or activities which satisfy the current requirements of the American Medical Association's Physician Recognition Award Program. So, I mean, it's fairly broad, but it really depends on what you're looking at I'm not even looking at physician's assistants or nurse practitioners. So it's kind of, I mean, there were the opioid credits that folks have talked about, right? That's a mandatory, I forget how many hours it is, but that's a mandatory credit that's kind of like universal for each one of those license types. I don't know if that's helpful. Yep.
Any further questions? Thank you, Counselor.
All right. Well, thank you for your time today. I appreciate it.
Your name is much easier to pronounce than Osterhout, and I've been working on that. Just tell him if you see Doug.
And
okay?
unlike Attorney Osterhout, I am a Red Sox fan, not a Yankees fan.
That was my follow-up.
All right, he can come back and
The chair recognizes Kathy Stratton from the New Hampshire Medical Society. And what is your position with them? The CEO. Are you a lawyer, a physician? You're a Ms. Okay.
Thank you. Dear Mr. Chairman, members of the House Children and Family Law Committee, my name is Kathy Stratton. I'm speaking on behalf of the New Hampshire Medical Society and representing the Medical Society's 2,000 physician members in opposition to House Bill 493, which would require education on child abuse and neglect for certain healthcare providers as a condition of licensure. I want to acknowledge the physicians, Dr. Gladstone and Dr. Oral, who have come forward to elevate the importance of identifying and reporting child abuse. On this, our vision and priorities are in alignment. This is an unusual position where the medical society and a medical specialty are not aligned. The medical society and our members are already working outside of the legislative process to increase awareness for child abuse detecting and reporting. The New Hampshire Medical Society's board, council, and legislative committee believe that this is an issue better addressed by the medical board, medical society, and physicians rather than legislatively. If passed, this bill requires new and renewing physicians and other practitioners who treat patients under 18, 2 or 1, however that lands, on child abuse and neglect on an ongoing basis. Physicians are already required to complete 100 hours of continuing medical education every 2 years. We believe this could and should include a broad spectrum of training and education that relates to improved clinical and practice knowledge and skill. Designating this issue as a requirement for all physicians creates a mandate that may be relevant for some, but may not for all. While pediatricians and emergency physicians may see these cases more often, other specialists or clinicians noted in the bill may rarely, if ever, be in a position to report child abuse. Requiring this broadly as this bill does, regardless of relevance to practice, may be inefficient and unnecessary. While child abuse education is undoubtedly important, legislating a strict condition of licensure adds another layer of complexity, cost, and administrative burden. Many physicians already receive education on child abuse through their medical training, workplace protocols, or existing CME requirements. Mandating an additional course may lead to redundancy rather than meaningful improvements in patient care or reporting practices. We believe a more flexible, non-legislative approach would be more effective without being unnecessarily burdensome. For this reason, we cannot support House Bill 493 as written and amended. Thank you for your time and consideration of my testimony.
It would be your testimony, contra to the testimony of a few others, that as you read the bill and the amendment, it does in fact not say anything about whether these 1 or 2 hours would be included in the 100 hours or not. It would be your inference. It would be an add-on as it was somebody else's inference. It was included in both cases, inferences.
And it's definitely unclear, yes.
Thank you. Representative Rice.
Thank you, Mr. Chairman. Thank you for taking my question. You had mentioned that they get training in their during like their medical training when they're training for the position. What if they're doing that in New York and we're in New Hampshire? How do we assure that they are getting training on New Hampshire's child abuse statute?
Thank you for the question. Our position is that it is not that the training is not relevant or shouldn't be happening. Our position is that it shouldn't be legislated. We're working with the physicians in the state to bring that information, however, that's relevant to the state. However, when it's mandated on an ongoing basis, that's our concern.
Follow up.
Thank you again for taking another question. So, how do you respond then to the numbers that we were given of only 59 doctors actually taking the course voluntarily, and the fact that 87 nurses have? I'm certain we have far more than 59 doctors and 87 nurses in the state.
Thank you for the question. I think my response would be that this has been newly initiated, and we need to raise awareness for it. We need to encourage our physicians to take the training. It's available. We've published articles about this in our physician magazine and distributed it just in the last 3 weeks to all physicians across the state. We're posting this information on our website. I think that there are non-legislated opportunities here for making this education and training available.
Would you believe I know enough about politics that sometimes the threat isn't what it seems to be?
Can you repeat that?
I think you want me to explain it. That sometimes when the legislature or a different branch of government makes what seems to be on face value a threat, we are really just trying to encourage others to say, hey, wait a minute, there's a lot of us out here who want this. What are you going to do about it? That often in response, people step up. My question is, to what degree is the New Hampshire Medical Society aware of what, to at least me from my phone and email, is a groundswell of people saying you got to do something about this more than is being done now? Are you aware of that as a board?
Absolutely, we are. And like I said, we're working with our pediatrician partners to make this available and to raise awareness. I think that this piece of legislation has brought forward that issue, and whether it needs to be legislated or not, I think it's elevated it in a very important way. And that's why I started my testimony with an acknowledgement for those that came forward.
I'm going to start my follow-up with a sentence that leads into a question. And the sentence is, I have asked some physicians and nurses, not necessarily on my own staff, describe what you look for in abuse and neglect, and was very pleased at the articulation they gave. I asked them, had they taken the course that was referenced here this morning, and they said, no, we just know this. So my question is, have you had similar conversations with physicians, nurse practitioners, physicians' assistants, and the like, and received similar responses that they do know?
We actually, no, we haven't. I think our position has always been to advocate for those vulnerable people. And, we haven't looked for the negative, in this, only that we want to support it. We just don't want to see it legislated.
Okay.
Thanks.
All righty. So another hand, Representative Corzine.
Thank you, Mr. Chairman. Thank you for being here. I understand that you're saying that you don't think it should be legislated. However, what does your society say about a physician who hears that a 7-year-old was hit in the head and has to go to the emergency room, and then that physician just forgets about it? How does your society plan on taking a stand against that so no other child has to do that?
Thank you for the question. It's devastating. I think, every physician takes an oath to do no harm. And anytime a situation like that arises, I think it's devastating. The society itself, again, is here to promote the education and the engagement with the resources that may be available. That seems to be more of an issue for the licensing board than for the medical society.
Representative Rice.
Thank you again, Mr. Chairman. Thank you for taking another question. So this bill language came out, I believe, last year. This committee heard this bill, but yet you stated that only 3 weeks ago you sent out in a magazine the importance of taking this continuing education. So how are we to believe that that's going to happen when this legislation's been heard before and it took how long just to get something sent out?
Thank you for the question, Representative Rice. I've been the CEO of the Medical Society for 5 months. So this is a relatively new position for me, and I'm not sure what position was taken by my predecessor or, in the past. The training and the opportunities offered by Dr. Gladstone and Dr. Orell came to our attention, and we immediately put it in our magazine. And we immediately promoted it in our weekly newsletter. So when it came to my attention, I took immediate action.
Follow up?
Do you happen to have the numbers of the people who have signed up since you sent out your newsletter?
We don't have access to that information. I'm sorry. I can look at it. I can actually provide some feedback on who's clicked on the links, if that would be helpful for the committee.
You may not be the one to ask this question to, but since Ben Bradley is left, don't hospitals provide this training to new hires?
That would be a question for the hospitals
Well,
and
like
hospital
I said, you may not be the one to ask.
I am not aware.
Because I was of that opinion. Okay.
But that doesn't mean a negative. It's not. It's just
you don't
my
know.
own limited
Yeah,
awareness of it.
Okay. Question over here from Representative George.
Thank you, Mr. Chairman, and I thank you to have my question. Because I'm just reading this testimony, the way she explained here, almost 4 years, I practiced in the Seacoast first as a primary care provider, and then especially she support really because if she think but she supported that bill because for how many kids go back home not reported and they have a problem because for that. Then how you can oppose that? Because just can you prove for me for that?
I think I need to clarify that we are absolutely not saying that we, how do I say it? We absolutely support efforts to increase the detection and reporting of child abuse. It's the mandating it legislatively that I am in opposition to.
Follow up, please.
Follow up.
Thank you, Mr. Chairman. And for me, you just can, for me, because if I hear everybody, what they say, and to read all those testimony, I think so. This is very important for the state of New Hampshire, and I think so. It's better for us to get a right decision. That's why I can say. If you don't think so.
Got to hit the button again. I'm sorry. I hit you instead of me here.
Thank you, Representative Georges.
Thank you.
Representative Love.
Thank you, Mr. Chairman. Thank you for taking my question. Now, you stated your opposition is to the mandate, and child abuse is a thing that's been going on since the beginning of time, and it's others have testified that the courses have been offered and they're available, yet it doesn't seem like anybody's stepping up and taking them. This is the reason for a mandate. Can you explain further explain how that just a voluntary thing might work where it hasn't?
Thank you, Representative Love. I think the feedback that you got was that this was the participation in this particular course. And again, I think it's, from my understanding, it's relatively new. So I think to say broadly that physicians and other clinicians are not engaging in child abuse training, education, may be unwarranted from that particular fact. So our physician members are very, very conscientious, and they want to do their best, and they take an oath to first do no harm. And if this course is available, and which it is, and I strongly believe that over time we'll see an increase in participation.
Thank you.
Representative Grund.
Thank you, Mr. Chairman, and thank you for taking my question. So it's same question I asked earlier to another person, but is the assumption of training being done the same as a requirement and knowing it is getting done?
Thank you, Representative, for the question. I'm trying to think of how to answer that, because the data of whether it's being done or not is probably available. Physicians are going online. Every 2 years, as part of their requirements, they are required to report to CE Broker what courses they took, and I would assume that the data is out there for present and past to look at which courses are being taken, and what the impact of that might be. I think this is front and foremost on people's minds right now. So and that's why we put it in the physician magazine, is just that it's really important for our physicians to update their training, to refine and refresh their skills. And again, it's not about it's not about the training, it's the mandate. And I think that there are other opportunities to look at this. It could be taken to the medical board, where it could be discussed there. That would be another avenue for which that, and other licensing boards, rather than having it enacted in state law.
Since I have received several phone calls from people indicating other mandated courses that the legislature should require, would you join me in being concerned that a bill like this, that on the sole issue of mandate, nothing else,
right,
would open or widen a floodgate of many bills essentially now telling how medical continuing education units should be conducted?
That's right. That's a strong concern of the medical society.
Okay,
Yes.
thank you. Any other questions? Seeing none, thank you. And I have no more pink cards. So I am going to close the hearing on 493. And I have to have an exec session on this sometime today. I could open it and then postpone it 2 weeks. I could do that. Or with some of the possible suggestions on the Amendment 662, such as specifically saying this is not additional, but part of, and looking at the question that was raised, should this be under 32916, not 169? Possibly an amendment could be crafted over the lunch hour. I hate to deprive you of lunch, but would you and my clerk, as the co-mentioned amendment people, be amenable to my giving you a little bit more time?
Thank you, Mr. Chairman. We definitely need more time. I do think we'll be able to get an amendment to you by this afternoon.
And if it's this afternoon, great. And if not, we got 2 weeks.
Yep, that sounds good. Thank you.
You're welcome. See, that's the advantage of being the acting, full ranking, honorary, minority party. I'm looking for the noun in here.
Goddess works.
That's it. You got it. All right. Now, for those of you who are watching or sitting there watching and listening, I'm inclined not to start the exec session on House Bill 10 in about 20 or 50 minutes or so, simply because we're going to have to stop for lunch. So if the next bill's hearing goes short and we have about 10 or 15 minutes, I will open an exec session on ones that are relatively easy. In other words, HB 10 will not be exec until this afternoon, probably about 1 o'clock. So that's for those of you who want to plan your day. I now open the hearing on House Bill 543, establishing a committee to study how the family division customarily treats accusations of domestic violence and to study current family division practices relative to the right to testify and right to submit evidence. And the chair recognizes the prime sponsor, who will eventually give us a pink card. Doesn't have to be right now. Wow. You did that in 3 seconds. That is a record. Wow. Representative Litchfield.
So, Mr. Chairman, I have submitted this bill on behalf of a former representative. May she come up as well in the interest of saving time?
Okay, it's your name on it. Are you liking?
I am the prime sponsor, Representative Litchfield. I have put the.
Can't hear you.
I'm
Hey.
the prime.
Too much noise. Go ahead.
I am the prime sponsor, Representative Litchfield. I have put the bill in on behalf of the Honorable Betty Gay. In the interest of time, I was wondering if she could come up right now.
Sounds like a plan.
Thank you,
were
sir.
so good in your speedy getting the pink card in. How
thank
can I
you.
refuse?
Thank you. I appreciate it. I'd like to say I really appreciate all that you do. I sat here listening through the last hearing, and it was difficult just to listen. So just know you're appreciated. Wow.
And we may all honor Representative Malone, who has about to change the paper that sits on the table that lets everyone know, or her designatee. Either one of you is fine. See, we run a loose ship here.
We were discussing in our committee yesterday, do you get a plate for that? Do you get a parking spot? And is it leadership?
That's above my pay grade, Representative.
She does. She gets down at the Store Street.
Oh, she does. It's called Stores Garage.
Oh, sweet.
Yeah. You know, they're going to have that new garage ready for us to vacate this building. You know that.
Yes.
That's how we work here. Former Representative Gay, to speak to this bill.
Thank you, Mr. Chairman. I thought I was going to come in as Part B.
You are Part B. She just did Part A.
Do you mind if I do a quick?
Or would you like to do Part A?
3 seconds, Chairman, Mr. Chairman. So House Bill 543, this bill establishes a study committee to examine the practices of the family division of the court in relation to domestic violence. The establishment of this study committee is crucial to ensure we're meeting legislative best practices aimed at improving the court's capacity to minimize risk and harm to families. During the proceedings of the Special Committee of the Family Court, extensive testimony was presented on the issue of domestic violence. However, due to the comprehensive nature of the committee's scope, there was inadequate time to thoroughly examine this specific topic. Furthermore, while the governor has a commission on domestic violence that covers a broad scope, including aspects including law enforcement, this study committee would focus specifically, on any legislation needed regarding the family court.
Thank you. I would like to point out that the subcommittee, if created, would be addressing immediately the denial of constitutional rights, of due process, of accepting testimony or accepting evidence. That's something I think that can be addressed immediately, because the violation of constitutional rights is exceedingly serious. We as Americans have these constitutional rights, but New Hampshire Family Court allows a judge to decide whether or not you get them. That's not a right. Okay, that's a privilege. And family court needs to run on rights. So my suggestion is you either pass the bill this afternoon that would immediately do that, or you immediately address it in this proposal. The Governor's Commission, I attended some of those. There was no testimony when I went from the people affected. It was just all the agencies. So agencies sat around and talked about what they do, but they weren't addressing the issues as people who were not treated well. And so they didn't talk about the problems that needed to be addressed. So I guess this is pretty simple. What I'm asking you to do, either pass the correction now this afternoon in House Bill 652, or accept the fact that it's a serious violation of our constitutional rights and address it immediately in a study committee and put in a bill. Don't talk about it for 2 years more.
I would address the representative and former representative asking, were you here when I appointed a subcommittee to deal with exactly this? That was appointed this morning.
Yes, I heard that.
So I'm going to move ITL when we get to exec, not because it's a bad bill. It's a great bill. It's been done. If we would have passed this bill, and then it crosses over to the Senate, and then the Senate deals with it, and then it gets to the governor, and then it gets assigned, and then they call me asking who should be on this committee, from the House point of view, that subcommittee or that committee might start its work in September or June, but not until then. It won't happen today if we exec it positively. Has to go to the floor, has to go to the Senate, has to go to the governor. But the subcommittee of this committee that was appointed this morning has 2 specific things to look at, and this is one of them. So it has been appointed.
Duplication would not undo the subcommittee.
Duplication would be highly confusing.
I think our IQs are higher than that.
I think some of the people who are most interested in this will be very welcome as guests at our subcommittee.
Yes, but if you are asked to start another committee, you already have the people selected, and you could even add more people to it. We really need to involve more people so that because lots of us are very concerned about domestic abuse and what's the problems facing family court, but we don't have a huge number of people aware.
Any questions for the 2 folks at the table?
Thank you.
Seeing none, thank you for your testimony, and this concludes the hearing. Ranking member, are we ready to exec this as ITO? Because we have just appointed the committee. Okay. Okay, as in my discretion, I open the exec session on this bill, and the chair moves ITL. Second was whom? Representative Rice wishes to, and I will speak to my motion simply by repeating what I just said. We've got the committee in place. We are very aware of this, and we're ready to roll. This is a wonderful bill, but is no longer necessary. Anyone else wish to speak to this? And when one of the clerks, two clerks, no waiting, you should get another clerk, you know that? Not that you're not good, but, it's always good to have backup. The chair will call the roll. The motion is ITL, moved by the chair, seconded by Representative Rice, the former chair. And it is ITL. Would the clerk please call the roll? If you are in favor of ITL, that's a yes motion. In other words, you have to vote yes to say no to the bill. You may call the roll. Either one of any of you.
First or last?
Oh, first.
Chairman Pearson,
Yes.
Representative DeSimone,
Yes.
Representative Rice,
Yes.
Representative McMahon,
Yes.
Representative Nelson,
Yes.
Representative Peternell,
Yes.
Representative Love. The clerk votes yes. Representative Markell,
Yes.
Representative Gregg,
Yes.
Representative Levesque,
Yes.
Representative Rung,
Yes.
Representative Grund,
Yes.
Representative Raymond,
Yes.
Representative George,
Yes.
and Representative Malone,
Yes.
16-0.
I can't hear you.
I move consent.
Is that okay? Yeah, consent, everybody? Good, thank you. And through the 543, and through the miracle of modern technology, I have the blurb ready.
What was the vote?
What was the vote?
16-0.
16 to nothing. And like I say, I just want to say it again. It's a great bill. And had this not special subcommittee been appointed, I'd say go for it. So we did it in a different way. All right. That concludes the exec session on 543. And since it's past 11 o'clock, which means this is legal, I will now open an exec session on House Bill 430, an act reducing the retention period for records of unfounded abuse and neglect reports by the Department of Health and Human Services. And the chair recognizes Representative Rice for a motion.
Thank you, Mr. Chairman. I move ITL on House Bill 430.
And a second, Representative Gregg and Representative Rice, would you speak to the motion, please?
Yes, give me 1 second, please.
Yeah.
So, are you ready for me?
Yep.
Okay. So reports of abuse and neglect can be deemed unfounded, but maintaining those records can show a pattern. And this is something we just put into statute in like 2017. And, no one else has access to your reports. It's all confidential. So the concerns we heard about, employers finding out or things like that just don't happen. So for those reasons and for protecting children, I'm moving ITL.
Anyone else wish to speak to it? Representative Gregg.
And I would like to reiterate for everyone that this is not, not something that people can get a hold of. And it also helps out when we're looking at statistically how things are looking in the state, how our courts are handling things. Looking at these reports, if the courts have to get into them, is very, very important. But once again, it is not something anyone can just go check like a sex offender registry or anything else. So while I think this is good intentioned for some people, it's misplaced and would overall do more harm than good.
Representative Nelson.
Thank you, Mr. Chairman. I just wanted to add that from a supporting the child or children standpoint, we also discussed that there may be an unfounded report on abuse of child A, but subsequent abuse may intensify to children B and C, and that might be recognized, and those children were supported. But looking back at a history, child A might also need that type of support that wouldn't necessarily have been recognized in the first report that was unfounded.
And Mr.
Representative Rice.
And if I could just add that the pattern can not only show a pattern of abuse or neglect, but it could also show a pattern of malicious reporting. So I think this benefits all areas. Thank you.
Anyone else, including our honorable guests? That's not to say they're not honorable, but you know what I mean. Up, the honorable guests up here. Seeing no further discussion, the motion before us is inexpedient to legislate on House Bill 430, moved by Representative Rice, seconded by Representative Gregg. One of the clerks, please call the roll.
Chairman Pearson.
Yes.
Representative DeSimone.
Yes.
Representative Rice. Representative McMahon.
Yes.
Representative Nelson.
Yes.
Representative Pettingill.
Yes.
Representative Love. Yes. Representative Corzine, yes. Representative Markell.
Yes.
Representative Gregg.
Yes.
Representative Levesque.
Yes.
Representative Rung.
Yes.
Representative Grund.
Yes.
Representative Raymond. Yes. Representative Georges.
Yes.
Representative Malone.
Yes.
16 to
Chair
0.
calls on the acting ranking member for a reminder of the chair.
Would you like this to go on consent?
I would. Any objections? And if we could have a report from Representative Rice, sometimes, wow,
Here you go.
Imagine.
that.
Oh, she's passing it down.
Holy.
This concludes the exec session on House Bill 430. Now, the chair opens the exec session on House Bill 661, relative to the Department of Health and Human Services management of Social Security payments, supplemental security stuff, income payments, and veterans benefits for children in foster care. And that would be on 661. And that would be the chair recognizing Representative Corzine for a motion, please.
I would like to make a motion of OTP on HB 661.
And do we have a second?
Over here.
We Representative Raymond. You know, I have not missed your hand this entire term.
No, this moving slightly has been
It
very
really
beneficial.
helped. Representative Corzine, would you wish to speak to your motion, please?
Thank you, Chairman. I will try. I believe that HB 661 is in the best interest of the child. This bill is specific to those who are awarded money from the state. In the past, DCYF has been taking that money. This bill hopes to put that money back into the child's hands once that child ages out of foster care. This could be huge for foster kids who are just starting their life. It could mean, you know, being able to buy their first car, or even put down first and last on an apartment. Our kids need this money.
Anyone else wish to speak on this? Representative DeSimone.
Thank you, Mr. Chairman. This money belongs to these kids. It's a no-brainer. It's their money. So why shouldn't they have it? So I've never understood why we would even contemplate keeping it from them. No child who does not receive Social Security has to pay back the foster care system. Why does a child who does receive Social Security have to pay back the foster care system? It seems an inequity there. I'm 100% for this.
Any further statements in this exec session on 661? Representative Raymond.
Thank you, Mr. Chairman. I just wanted to add that the bill doesn't mandate that the state save all the money for the child. What it says is that the state has to consider what the best application of the money is. And I know when I worked at DCYF, there were cases where a child being removed from the home and that Social Security being removed from the family meant that the family could no longer pay their rent, which meant that the kid didn't have a home to ever come back to. And the fact that that happens is appalling. And, you know, I think that this bill will solve some of that problem. I would love to also save money for kids when they age out. I think that's really important. But I also want to maximize their chances of going home when their parents rectify their parenting errors and not set the family up for failure from day one.
Anyone else? The motion before us on House Bill 661 is ought to pass. Moved by Representative Corzine, seconded by Representative Raymond. Would a clerk please call the rolls?
Chairman Pearson.
Yes.
Representative DeSimone.
Yes.
Representative Rice. Representative McMahon.
Yes.
Representative Nelson.
Yes.
Representative Patino. Sorry.
Yes.
Representative Love.
She's here all day. You'll get a good.
All right. By the last one, I'll get it. Representative Love.
Yes.
The clerk votes yes. Representative Markell.
Yes.
Representative Gregg.
Yes.
Representative Levesque.
Yes.
Representative Rung.
Yes.
Representative Grund.
Yes.
Representative Raymond. Representative Georges.
Yes.
Representative Malone.
Yes.
16-0.
Chair calls on the ranking member for a suggestion.
Would you like this to go on consent?
I would. Any objections? That doesn't always mean what it looks like. So we will say yes until somebody above our pay grade says no. Okay? And how long before we can have the committee report? Why? Right now. I know I have to look it over. I actually have seen it, yeah. All right, well, I have to sign it, though. This ends the exec session on 661, and now we're going to go get a hard one here. And we're not going to do 10 because we want to start after lunch. We're not going to do, well, we could do 285. Let's see, what's up? No, we're going to wait on that one. All right, let's try a hard one. Opening the exec session on House Bill 652, which
Chair?
is an act to abolish the family division of circuit court, create the Office of Family Mediation, and reassign the jurisdiction of the family division. And the chair recognizes.
Mr. Chair?
The chair recognizes, Jody, you ready to go? Or Lori? Well, they all both have 4 letters. All right, the chair recognizes Representative Corzine for a motion.
On Bill HB 652, I would like to retain this for committee.
The motion is to retain. Do we have a second?
Right here.
Who was the second? Representative Love. And Representative Corzine, would you speak to your motion, please?
I would like to retain this for study because we do recognize that there are issues within the family court system. I know that there is the subcommittee that's already been presented by Chairman Pearson, and I would like to make sure that this issue specifically is really looked into and not just brushed aside.
Anyone else wish to speak? Representative Gregg.
I disagree with this motion only because we do have, we already have the subcommittee. And also, I think that we've learned anytime that we have a bill that has a hostile nature for the courts, it's harder to get cooperation. It's harder to get people in to testify. And I do think this bill is incredibly hostile in nature. I actually think that puts our cooperative efforts with the family courts as far as finding issues and fixing them in jeopardy. So I would go against this motion.
You would think a proper motion, or in your belief, would be what?
I think a proper motion would be ITL, and I would really encourage the sponsors of that bill to come to our sessions and really learn all that we get to suss out, because we certainly have made a lot of good momentum from our last subcommittee.
The topic of retain versus ITL was one of considerable discussion in our caucus, and we see both sides to that. So what I would suggest we do presently is have a brief discussion as to whether different ones of you think let's retain it, which does not necessarily mean we have to do a lot of work on the bill. It means we do a lot of work on the topic, which is the subcommittee, or we simply ITL it outright. So I'd be interested to see what other committee members think if the issue is retain versus ITL. Hands, Representative DeSimone?
Thank you, Mr. Chairman. Just to reiterate most of what you just said, this morning you identified a committee that will really look into the court system. If this bill continues to be what we believe it is, then it's very simple. In the fall, our retention report would just read that the bill was unnecessary. Simple, easy. If we find that there may be some issue that needs to be looked at, then I suppose we could entertain a motion otherwise. But right now, I think that retaining it is, for me, it's the optimal motion.
Anyone else want to weigh in? Yes, Representative Levesque. Now, those of you from Coos County should know French. This is Levesque.
You are good. I get both from many different people.
We be a little bit louder, especially the you half of we?
Yeah. I get both Levesque and Levesque. Levesque. Yeah. I have to agree with Representative Gregg's point of this is very hostile towards the family court system, saying that we should just get rid of it and put it towards back into the Superior Court's hands. Despite, there is some good that they do. Yes, we know this is the worst part of someone's life. They're going through a divorce. They're losing their child from all the time to part of the time, or even just holidays, depending on their work schedules and everything. It's a very hard time in that person's life. And to just have, the Superior Court has a lot on their plate. Mediation has a lot on their plate. And I think that putting it on those entities versus having that separate court system dedicated to the family courts is definitely very hostile for that. And I don't think that this is a way to go about that if we do want to bring it back to the Superior Court system.
So, in one word, do you suggest ITL or retain?
I support ITL.
ITL, okay. Anyone else? Representative Love?
Thank you, Mr. Chair. I'm supporting retain for the one reason that we've just established this committee, and I'm expecting the committee to do great work. And if we come up with something that needs rather expedient attention, having this bill sitting there that we can just amend at any time and put what we need to do right away in it, rather than going before a rules committee and waiting for non-germane or germane amendment decisions. I think this is a pretty important thing. I think we can all agree that the family courts have some serious holes in it, the way we operate. And we wouldn't have this committee if we didn't. Let's have this bill sitting there waiting to amend with any ideas we come up with. Thank you.
Representative Gregg.
Thank you, Mr. Chairman, and thank you for that. While I understand that you want to have a bill at the ready, the subcommittee can also recommend bills and stuff. One of the things that I have great pride with in this particular committee is that we're very intentional about things. We don't hold on to things just because we want them to kind of like go hide in the corner and get cobwebs until we can make them go away later. We've been incredibly intentional. We understand the dynamics within the court systems. We have taken great time to hear from the courts what's going on and building this relationship. Having what I call a threat bill hanging over in the side not only goes against everything that we work for in this committee, it also really goes against the better judgment of how we want these relationships to continue. You have said repeatedly, we were able to get low-hanging fruit. I was able to have something come up. We discussed it in committee, and they were already working on it. And now, because of that one little thing, not only are they working on the family courts with communication, it is also has a test program in the superior courts. I understand the frustration. And the frustration, by the way, is not with everybody. It is in our high conflict cases. I am very sympathetic to that. But this doesn't fix anything. Putting it in a corner and making it wait also doesn't fix anything. It just puts us in a situation where this, it's kind of this thing like, it's just over there. And it really shouldn't be there. Like, I strongly think that we should hold to what we have done in our hard work in this committee and stick to that.
Anyone else? Representative Raymond.
Thank you, Mr. Sorry. Thank you, Mr. Chairman. A lot of the testimony that we've been hearing about people's concerns about the family court have a lot to do with evidence, rules of evidence, and they have a lot to do with the lack of the ability to appeal rulings that they feel were unfair. And I don't see that this bill improves either one of those things, because now instead of having a judge, we're knocking it down to a mediator. There's nothing in here about how we will improve evidence or improve the ability to have people be able to appeal their things to something other than the state, Supreme Court. So I think that there is work to be done, and we've gotten a lot of feedback that's starting to create a roadmap. But I don't think that this bill is aligned with the feedback that we heard from the committee last year, or even the testimony on this bill and other bills, which is weird. Like it doesn't solve the problem that we keep hearing is the problem. And I would love to see a bill that solves the problem. I need more information still.
Anyone who has not spoken yet? Representative Rung.
A question. I noticed that the fiscal note this bill was awaiting a fiscal note from judicial. Did that ever arrive?
I haven't seen it. I'm not going to say it didn't arrive.
Okay. All right. Thank you.
Representative George.
Thank you, Mr. Chairman. I think so. I support it to go to the subcommittee because they can do more research. Because a small group can work very well. How to looking for what is going on, because there is a problem. I can say there is a problem, and the problem we need to fix it. For that problem to fix it, it's better just go to subcommittee.
Okay, thank you. Representative Love.
Thank you, Mr. Chair. I just need some clarification. I've heard people testify that, we work nice with the family court. And the family court's troubled, like we've all said. Does the family court answer to us, or do we answer to them?
Neither one. We are separate branches of the government, which is why a collaborative attitude is far superior to the hostile attitude that others display. And we have gained their trust and vice versa, which does not mean we can tell them what to do, but we've already seen at least one example in the special committee where they're already going to work on it before we even had the subcommittee hearing. And there's two possible reasons for that. Number one, they fear Representative Gregg, or more likely, they've been listening in and saying, oh, yeah, That sounds pretty good. Let's do it. So the subcommittee that was just formed was picked by me, and for the purpose of people who play well with other children and have some knowledge of the law, to continue the tone and the relationship the special committee had had with the judiciary. But they don't report to us and we don't report to them, really.
Do we set the rules or do they?
Depends on the rules.
Apparently the rules, from all the testimony I've heard, the rules are very broken. And
We're aware of that, sir. Very aware of that.
I wouldn't worry about what they feel about it because they're so broken.
I am happy that they feel that we are an asset to them and not an invading army. And I wish to continue to do that with them going forward. Anybody else on this? Either motion I could support, we retain it, and subcommittee continues to do our work, and we just have this other thing in the corner, or we kill it outright. Either one will work. It'll be a little different way of working it, but either one. Anything further? The motion before us is to retain, moved by Representative Corzine and seconded by Representative Love, and the chair would like to go last on this. Would the clerk call the roll, please? The motion is retain.
Sorry. Representative DeSimone?
Yes.
Representative Rice?
Yes.
Representative McMahon?
Yes.
Representative Nelson?
Yes.
Representative Pettinel?
Yes.
Representative Love?
Yes.
The clerk votes yes. Representative Markle?
Yes.
Representative Gregg?
No.
Representative Levesque?
No.
Representative Rung?
No.
Representative Grund?
No.
Representative Raymond? No. Representative Georges?
Yes.
Representative Malone?
No.
That's gonna be 9 to
Was it 10?
9-6.
No, you didn't have
Oh. Chairman
My-
Pearson?
Well, my vote actually doesn't make any difference, so I'm going to say yes to retain because it would have won irrespective of how I vote. So the bill is retained 10-6. There is no need of a report. It doesn't go anywhere. We keep it in committee.
Right.
And we will work on this topic. It is one of two we will begin with. And with that, we end the exec session on 6:52, and we will reconvene at 1 o'clock.
Yeah. I couldn't open it. Oh, shoot.
Thank you, Mr. Chairman. I would like to make a motion. Do I want to do the amendment? Of OTPA, and I would like to introduce an amendment as such.
Second by Rice, and please pass the amendment around.
I just want to be sure that it is the 0695.
695.
Yes, okay.
Okay.
One, what's an I?
And this is a packet of the same.
4, 5, 7 there. And no, I'll need one, please.
Sorry.
I need just one. I'm good. Okay.
Well, it
Yes.
wasn't.
This amendment will replace all other amendments that I have had anything to do with. And Mr. Chairman, if I may, I'd like to speak on my amendment.
And show us particularly how this amendment differs from the previous one that we have all seen.
So the previous amendment that you all received when I introduced the bill has only been changed by page 2 under all parents' rights are reserved, and it is the only changes under lowercase a to include to inquire of the school or school personnel and immediately receive accurate, truthful, and complete disclosure regarding any and all matters related to their minor child unless an immediate answer cannot be provided when the initial request is made, in which case the answer shall be provided no later than 5 days after the request. That is the only difference between the previous amendment and this one.
We'll give everybody a minute or two to look at the new amendment, the newest and lastest amendment, and duly note the change from the one we previously looked at, most of us.
What's it?
And since this amendment 0695 is a case of amend the bill by replacing all after the enacting clause, the original HB 10 is, should this amendment be approved, old news.
Yes, sir. You have a question?
Representative Raymond.
Thank you, Mr. Chairman. So my question is about procedurally, because there is also another amendment, and I'm curious if we are able to entertain more than one amendment at the same time. I know we've had
I
circumstances.
believe we have to look at the amendment before us and make a motion accordingly. I would allow the other amendment to be distributed so you could look at that, but we have to dispose of this motion of ought to pass with Amendment 695 before we would consider another one. So Representative Gregg, if you have copies of your amendment, or do we?
It's, yeah,
It has been. It's Representative Raymond and Petrino and Gregg.
Yes.
So if you want to take a look at that and do a side by side, both of these will be relatively new to many of us, and go from there. But we do have a motion.
Are we able to note that the amendment from Representative Raymond is actually mirrored from the Senate Bill 72 that just passed through their committee?
I would suggest, yeah, we can note that.
I have an extra.
And Representative Gregg, I only heard part of what you said. What is this amendment from Representative
Senate
Raymond?
Bill 72, their Parental Bill of Rights.
HB 70,
SB.
SB 72,
Yes.
the Senate. And how did that turn
That
out?
passed through committee.
Passed through committee.
We have one minor change to this. This is just a procedural.
All right.
Otherwise, that's what it is.
Yep.
Have they voted on it on the floor yet?
Not on the floor yet.
Not on the floor, just, how did it come out of committee?
It's Senator Lang's bill. It came out of committee 2-1. Senator Long had some quibbles with clear and convincing as the standard of proof, because that is not the standard of proof in the Child Protective Act. So we left that you need evidence, and we just crossed out clear and convincing. The only other change to Senate Bill 72 was aligning. Sometimes it said a minor child, sometimes it said their minor child, sometimes it said his or her. We simply changed all of those to his or her minor child so that they were all the same. Yeah, it was not controversial.
Yes.
Just stylistic.
Representative Ron.
Thank you, Mr. Chair. I noted that in Representative Raymond's amendment and Representative DeSimone's and the original bill, it defines parent as parent means a person who has legal custody of a minor child as a natural or adoptive parent or legal guardian. But in Representative DeSimone's amendment, it defines it as parent means a person who is the legal, natural, or adoptive parent of a minor child. And I know I wasn't here for the hearing, but I don't know what legal natural means. That seems like that's a change from the original bill.
Okay, Representative Rice to that point? Okay, anybody to this point, if anybody knows? Representative DeSimone.
The point to the legal, natural, or adoptive parent is made because you can be a biological parent and have your parental rights removed by a court of law.
Follow up. So is that term legal natural defined as that, as such in another area statute or in this area?
It will be.
Okay, but it's not in the amendment, the legal natural.
No, ma'am.
Okay, thank you. So, I mean, to me, that's a flaw of the amendment because we're using a term that's not defined.
Thank you for your opinion.
Representative Rice.
Thank you, Mr. Chairman. And with all due respect to my colleagues across the aisle, I'm not sure why we're amending a Senate bill that we haven't seen yet. If that's something that needs to be done when that Senate bill comes to us, then I would say we would address it. But to amend the House version to match a Senate bill seems redundant almost.
It has been offered as a legal House amendment to this bill. Where they get their language is not the point.
So,
in your opinion. Well, Representative Raymond.
I would suggest that sometimes what happens when we have competing bills on both sides of the State House is that we end up having two different things that pass that don't match each other, and then we have to have a committee of conference. By aligning our bills at an earlier level, we avoid that unnecessary delay, especially if we agree in principle on the matter at hand, which is that parents have rights and they should be collected in a convenient location. What the Senate did that is different than what the House bill did was the Senate did not take up medical records in this. Personally, I like that because we have HB 560 before us this afternoon, which only considers medical. So this would be parents' rights in education, and then there would be a separate bill for parents' rights with medical. And again,
who want to raise productive members of society and have the rights to information in order to support the way they want to raise those children or educate those children. I think this amendment speaks to all of that, and I think that this amendment speaks to the 13 other states that already have a bill such as this, and the 32 pending legislations in 32 other states that is similar to this language. So I think that New Hampshire, being the kind of a state that promotes healthy families and healthy parents, and more importantly, healthy, productive children, this amendment, I'm hoping that you would understand its necessity and vote ought to pass. Thank you, Mr. Chairman.
Representative Corzine.
Thank you, Mr. Chairman. So I love HB 10 as you amended it. I think it is more inclusive and more encompassing than the amendment from Representative Raymond. One thing that I love about your amendment is that it includes the healthcare practitioners. I think that as far as the parents that I talk to, they are worried about all of their parental rights. So I do like that this bill talks about that as well. In just glancing at this amendment from Representative Raymond, Petrino, and Gregg, their amendment actually gives medical providers an out for answering to a parent. So I think that HB 10 as written and as amended today is a far superior bill.
Before lunch, Representative Markell showed me a document. It's the up-to-date parenting plan, and he showed it to me in part because he was noting how the bill and amendment before us tracked ever so well with it. Would you care to speak to that, sir?
Yes, certainly, Mr. Chairman, and thank you for allowing me to address the issue. One of the things that comes out in parenting plans, which are part and parcel of either unmarried parents filing parent petitions in court dealing with their children, or divorcing married parents who also have to have parenting plans, and they're required pursuant to RSA 461A. One of the things that they do is they include language in there about information access and sharing. And basically what the courts are saying is that you have the rights to basically the information that that are being identified for the most part in HB 10, the amended version that we see here, 2025-069H. So when we look at that, that basically tracks it. It summarizes it. So it's kind of interesting because what the parenting plans are actually saying is these are the rights you have. So this bill actually puts parents on notice what they would actually be getting if they're not in that situation to begin with and have to go to court to figure it out. So I think that's important. And by way of just closing comment on it, is that parenting liberty interests that you have under U.S. under the Constitution as federal Constitution as interpreted by the U.S. Supreme Court, and under the New Hampshire Constitution as interpreted by the New Hampshire Supreme Court, are that you have a fundamental liberty interest in raising your children and directing their care, education, and so forth. However, the limiting factors are when you go to court, or, for example, when you go to court and either invite the state in, which you do either by filing a petition for divorce, or voluntarily inviting the state in by filing a parenting petition in the case of people who aren't married, or you involuntarily are subject to the state's competing interest by engaging in acts that are abusive or neglectful of your children. So this, I think, serves as a good model, and to sum it up, it's certainly something I would support. Thank you for allowing me to address it, Mr. Chairman.
And thank you. Any other comments? The motion is on HB 10 is amended by 0695. After this vote, the chair will then recognize a motion for the other amendment, 0699. Any questions? Yes, Representative Gregg.
Thank you, Mr. Chairman. Specifically on page 4
of
the DeSimone amendment, the most recent one.
Page 4.
Lines 17 and 18. If you remember, so this did not change. I asked in our session on this, particularly if this was just for public schools, if that was, and they said that this was intended for all schools. So I'm just wondering, when we still on line 17 and 18 have the right of a parent to inspect school district instructional materials, once again, this opens this up for any parent to go after any school, including the home schools, including the private schools, and say, because it doesn't specify the parent of a child in that school, we now open this up. We do know that we have people that have traveled to every school board in the state to request information and stuff. So this is once again a huge thing that I am worried about, because this opens it up to any of these for any parent to do it. I'm a parent. I could certainly go up to any of the private schools that even our own representatives have and request documentation. So that's a worry.
May I speak to that?
Representative DeSimone to respond.
Thank you. I specifically put in here school district, because whether it be homeschool or any other type of school in the district makes the determination of the instructional materials. And quite frankly, if a parent is searching for a new home and is leaving one school district and going to another school district, that parent should have the right to inspect that school district's instructional materials to make sure that if they do move to that district, it is a school that would be a good fit for their family. So I specifically did not go any deeper than that.
Follow up.
So then it's fair to say we are only making sure that parents have rights in public schools. Is that correct?
Public or private, depending upon the school district's instructional materials.
Representative Corzine. She's confused too. There is a epidemic of confusion here. Anybody who's not confused who would like to speak?
It's in the water.
It is not in the water. Representative Corzine for the rescue.
Yes, thank you, Chairman. Don't we as taxpayers have a right to go to a school district and ask for curriculum anyway?
Yes.
And if you're considering putting your child into a private school, I don't know of any that would withhold their curriculum from a parent who was interested in sending their child.
Correct.
Neither do public.
Anyone else with a hand up? Representative Rung.
Thank you, Mr. Chairman. I mean, aside from the problem with the definite lack of definition, the one thing I would love to see in this amendment and the other amendment in the bill is talk more about parents' responsibilities. Certainly, they have a right and expectation to participate in the selection of approval of academic standards, but I think they have a responsibility too. I know it's not going to be in here, but I mean, just from the testimony we heard this morning regarding child abuse, it seems that we need parents to take as much responsibility as they do rights. So that's just a comment. Thank you.
You may respond.
Thank you, Mr. Chairman. On the very first page, under parental rights and responsibilities, it says they shall have the same meaning as care, custody, control, and shall include parenting time, decision-making, and residential responsibility, parents for whom such rights to care, custody, or control of a child have been abridged, halted, modified, or suspended, and shall have their rights restored upon showing a preponderance of the evidence that is in the best interest of the child. I felt that that definition was enough to enter into the Bill of Rights to state that the parents shall parent their child according to the law.
Follow up?
Yep. Thank you, Mr. Chairman. Yeah, I just think that this is a long document, and I think that one section isn't conveyed, I think, in my opinion, to communicate the important and the vital role parents have in being responsible parents. I look through this, I've raised 3 children. I've always had these rights. But what bothers me is we talk a lot about rights of parents, and I think sometimes we don't set the expectation of their responsibility. And in some of these things, particularly in accessing their medical records, working with their schools, they have a responsibility. I once talked to a father who 4 or 5 months into the school year didn't even know the building where his child went to school. I consider that irresponsible. Is it illegal? No. There's not going to be anything we find in law that makes that illegal, but I think if we're going to establish rights, we need to put equal weight into responsibility. Thank you.
As I've often said, I have been accused on some occasions of packing too much into a bill, that it should be clean and simple on one topic. If I have more things to say, file another bill. And I've been accused of the direct opposite. So this is the bill. We're dealing with these things. Representative Georges.
Thank you, Mr. Chairman. I'm a little bit concerned because I saw just a little bit. I've been in school boards, and I know what's going on inside the school with the teachers, with the kids, and the parents. And I see a lot of parents who always just sue the school, or sometimes the kids doesn't even respect the teacher because the parent always be over everything. I think so. We give it just more parents, but we don't talk about how it's going to be the relationship for the kids and the teacher and the parents for this bill, because this is very important for me.
Representative Gregg.
Thank you, Mr. Chairman. One other concern that I have is on page 2, line 25. It specifies that access and review to all medical records, ... The parent is the subject of an investigation of a crime committed against the minor child. We do know in this particular committee that when somebody is under investigation about child abuse, it's not under investigation of a crime. So many of our child abuse situations, certainly when we're trying to get interventions for parents and stuff, are within the civil court. I certainly know that in my own personal experience, when my late husband was being investigated and our situation was such that we were separated for 6 months, he was trying to get the medical records. We were able to make sure that he couldn't. He wanted to see what had been turned in, and in hindsight, it was to bolster his criminal case when that got filed. But that is certainly a consideration. So just saying that investigation of a crime committed, that's pretty hard to prove, and that's not always what's going on in abusive cases. Unfortunately, it is just not in the criminal. It takes a lot to get it into the criminal court. So especially when we need interventions, but it doesn't mean those parents should be able to access that medical reporting.
Representative Markell.
Thank you, Mr. Chairman, for allowing me to address your concerns. When that was written, there's a couple of things that need to be looked at when we're talking about privilege and when we're talking about medical records and people who treat adolescents or other children. There's some research that went into this. Okay, first, if there's going to be there's the civil aspects of it, and then what you're talking about might be criminal. Okay, as a general proposition, you have a right basically under the federal and state constitution. You have a right to see evidence that's going to be introduced against you. You know, for example, people who commit horrific crimes, particularly against children, that evidence is going to have a right to be challenged. So it wouldn't be withheld. It would be unlikely to be withheld in the criminal context. Now, addressing the civil context, which is where I think you're going with this, is that your real question?
Can I answer? So specifically on letter H. So if you look
Okay.
at line 23, so that's where this, so this is for a parent, because we're talking about parents' rights only in this, access and review to all medical records as the personal representatives of their children.
That's
There are
correct.
many parents who, for whatever reason, are not necessarily, their parental rights have not been terminated and stuff, but they are separated from their children because of allegations. It doesn't mean that they're under criminal investigation.
Correct. So that's what I was asking. Thank you, Mr. Chairman, for allowing me to address that. See, so what happens if you go into the civil context, which is where I think you were going with this, is that there's already case law on point. I think we've brought it up before, but for a good one to look at is in Reberg, okay, which is a New Hampshire Supreme Court case from 2005, where in the middle of a rather contentious divorce hearing, the Supreme Court, and this case went up to the Supreme Court, which said that basically privileged records that children, particularly with psychiatric records or those kinds of things, do have standing to have a privilege asserted. Okay. Now, if you're in that kind of contentious position, all right, then somebody is going to have to go to court and prevent you from getting those records. And that's always, almost always going to be fact dependent. Okay. So, almost always. I can't see a situation where it wouldn't be. This would be under normal circumstances. So what you actually are doing here is balancing the rights of a patient, okay, against the right of a parent. So, for example, when personal representatives, for example, my research shows that personal representatives under HIPAA, okay, actually have the same standing as the patient themselves to be able to get records. Now, if we're talking about abuse or neglect, or if we're talking about allegations where there are serious problems, and somebody wants records and they want them for some nefarious purpose, then there's room for intervention. So this balances the rights of this balances the rights of parents and the rights of patients to have their rights protected. People may disagree on that, but the point of it is that's what I think it stands for.
Representative Raymond.
Thank you, Mr. Chairman. So I want to go back to page 5. At the bottom, Roman numeral 2, line 23. It says, except as otherwise provided by law or court order, a health provider shall not allow a medical procedure to be performed on a minor child in its facilities without first obtaining written parental consent. I want to know where the exception is for emergency situations. I'm thinking about our dear friend and colleague whose child was injured at school and needed immediate emergent treatment before she was physically present and able to sign a consent. Now, there are other laws allowing those things, but would this require both parents to be there? What if only one parent can be there? How is this going to impact the daily routine parenting of people, where we frequently, when you have two parents, tag off on who's going to do this appointment and who's going to do that appointment? What if one parent objects?
I believe the operative phrase in 1923 and 26 is, 19 and 23 is, except as otherwise provided by law. And I'm wondering if our resident lawyer could expand on that.
Thank you, Mr. Chairman. Yes, I can. Other statutes provide for, you can dispense with consent for emergency medical treatment. Okay, so that's as otherwise provided by law. In the case of warring parents where they are just at loggerheads, what this requires simply is parental consent. Okay, so if one parent consents, then that's enough. And if you're going to go to court, and then if a parent is, we see these conflicts all the time in court, and that if a parent is either going to be ornery or just contentious, obstructive, or engaging in some other conduct which is detrimental to the well-being of a child, they're going to have to answer for it.
Representative Nelson.
Thank you, Mr. Chairman. So in the event of an emergency in a school setting, on page 5, line 29, says this section does not apply to emergency services pursuant to RSA 153-8:18. So I think
Bingo.
that would be taking
Bingo.
care of that.
Okay.
Thank you.
Welcome. All right. The motion before us is on House Bill 10 with amendment 695. And this was moved by Representative DeSimone and seconded by Representative Rice. That is the motion. 10 with amendment 695. Would the clerk please call the roll? Yes, first. We have not. We are on the adoption of the amendment, as I should have said, but didn't. Thank you.
Chairman Pearson.
Yes.
Representative DeSimone.
Yes.
Representative Rice.
Yes.
Representative McMahon.
Yes.
Representative Nelson.
Yes.
Representative Pettinel.
Yes.
Getting better?
I am. Representative Love. Representative Corzine votes yes. Representative Markle.
Yes.
Representative Gregg.
No.
Representative Grun.
No.
Representative Rung.
No.
Representative Levesque.
No.
Representative Raymond.
No.
Representative Georges.
No.
Representative Malone.
No.
Nine seven.
9-7, the amendment passes. Those of you who are up on these things, do I call for the next amendment now, or do I call for the bill as amended? That's what I thought too, and then we can do another amendment. Okay. All right, call on Representative DeSimone for a motion.
Mr. Chairman, I move House Bill 10 OTPA
As amended by 695.
as amended by 0695H.
Okay, and that was DeSimone, and who was the second? Representative Rice. Any discussion? Call the roll, please. Yes.
Chairman Pearson.
Yes.
Representative DeSimone.
Yes.
Representative Rice.
Yes.
Representative McMahon.
Yes.
Representative Nelson.
Yes.
Representative Pettinel.
Yes.
Representative Love. Representative Corzine votes yes. Representative Markle.
Yes.
Representative Gregg.
No.
Representative Levesque.
No.
Representative Rung.
No.
Representative Grund.
No.
Sorry. Representative Raymond. Representative Georges.
No.
Representative Malone.
No.
9-7.
9-7, the chair is open for a further motion. A further amendment, a motion on the amendment?
Thank you, Mr. Chairman. I think that I'm trying to decide if it's worth moving the amendment to have it fail 7-9, or if it's worth calling it a day on this one.
Would you like a few minutes to talk with your colleagues?
Thank you.
Thank you.
Yeah, I don't think we need to go into, yeah, yeah.
Wow. Well, Lauren, I love that. You know, that's so much more tradition. Come on.
I think the chair over but actually,
Sure, then we can still bring it down.
Democrats because this is split. Normally I would just say our committee because I think that's our power position, that we like to do things as a committee, as unanimous as possible. And that's honestly why we worked on this amendment. We understand that I'm a mama bear to full tilt. And to be able to have rights and to always know that I can go into my child's school, even if she's in a private school, and, you know, look at the curriculum, say that I don't want her in anything is incredibly important to me. It's incredibly important to all of us. The reason for this amendment is that we saw issues. First of all, I see an issue with only targeting kids in public schools and making parents who are in public schools think that, you know, they're the only ones that can do that. I think that's a problem. I also think that not having menacing situations where we have parents going all over the state, although I do understand about the moving and stuff. I also, you know, we looked at this not because we wanted to copy the Senate bill, but because we looked at the sponsors on the Senate bill. We understood that they have the same heart, that they would like to see parental rights all in one place. We also see that. That's a confusion that we continue to hear. Not that people, I think we've talked about it over and over, that parents do have rights, but the fact that it's not all in one place, that it's not easy for people to see, that's a problem. And we hear that and we want to support that position. In looking at the Senate bill, certainly it was not a Democratic bill. But we saw that it had some strengths in it as far as keeping within the legal tone of what we're looking at specifically about the medical, wanting it not only to, I think the intention is the same, but I know that they had a care really looking at aligning with the Child Protection Act. I think that was a big thing. I also think that it was a big deal, and I'm probably getting way too wordy, but it was a big deal also to align with federal law as far as the medical part of it. We certainly don't want something that parents are going to think that they have, and then federal law is going to pull that back and they don't actually have that. So this amendment really speaks to all of those. It also honors the work that we've done on this committee as a full committee, and understanding that we are for parental rights. And we know that there's a need to have it in one place. So I hope that everyone would consider this amendment. I think it's a strong amendment. And certainly, I think we could get 2 houses to agree on it. Thank you.
I think from my perspective, having sat on many committees of conference, sometimes the good stuff wins out, and sometimes the stuff that we didn't do, that they did, prevails, and we do have another shot at it should this amendment not pass. So it's not the end of the road on this, and I'm glad you articulated it, because I've written some of these things down, and should I get put on a committee of conference, I'll certainly bring our committees, or at least part of our committee's thoughts on this. Anybody else? The amendment, the motion before us is the amendment 0699 on House Bill 10 as amended and passed just a minute ago, moved by Representative Raymond, seconded by Representative Gregg. The motion is ought to pass. If you agree with this amendment, you'll vote yes. If you disagree, you will vote no. Would the clerk call the roll, please?
Chairman Pearson.
No.
Representative DeSimone.
No.
Representative Rice.
No.
Representative McMahon.
No.
Representative Nelson.
No.
Representative Pettinel.
No.
Representative Love. I vote no. Representative Markle.
No.
Representative Gregg.
Yes.
Representative Levesque.
Yes.
Representative Rung.
Yes.
Representative Grund.
Yes.
Representative Raymond. Representative Georges.
Yes.
And Representative Malone.
Yes.
The motion fails 9-7. So the standing motion has been voted OTP on House Bill 10 with Amendment 0695H. That has now been voted favorably out of this committee. And Representative DeSimone, if you don't have your blurb ready, start writing. It is, just in case. And Councilor, do we have, not yet? Yeah, would you see if we can get it down here, because we're going to be looking at that pretty soon. They may have met in the morning. Oh, they did. Okay. All righty. What have we not done? Have we not? I got to look at this. I'm choking in paper. Ready to go with, are we ready to go with House Bill 285? We are? Okay, who is? I open the exec session on House Bill 285. This is one little line item focusing on mental health as a consideration for parenting. And the motion was by whom?
Me.
I heard it. My illustrious predecessor moves what?
ITL.
ITL, that is Rice and DeSimone. And would you please speak to this?
Certainly. HB 285 unfairly singles out mental health conditions as a factor in custody decisions without requiring any evidence that the condition negatively impacts a parent's ability to care for their child. This broad and vague language could lead to discrimination against parents who manage treatable conditions, discouraging individuals from seeking necessary mental health care out of fear that the diagnosis could be used against them, And custody determinations should be based on specific behaviors and the actual well-being of the child, not on generalized assumptions about mental health. And there you have my blurb.
Oh, Mr. Chairman?
At first, I thought this would be a good reminder, but then I realized after some conversation with some judges, they really do take this into account. And by separating it out as a special line item, it might point a finger a little more pointedly than to other folks. So I had an amendment prepared to soften it. And then came to the conclusion, was persuaded by my caucus members that it's really not needed at best, and at worst, it could be discriminatory. So I just wanted to say I agree with that. Representative Raymond.
Oh, thank you, Mr. Chairman. I agree with you. Also,
You want to follow up?
no, can I have the sheet for the minority report for the previous bill, please?
Sure, of course.
I should have asked earlier, but I forgot till just now. Thank you
Anybody
so much.
else? Representative Gregg.
Thank you, Mr. Chairman, and thank you. I know that the prime sponsor is in the room. I do want to honor the struggle and why this bill comes about, and I do think that we have other legislation including definitions, that will really, without calling it out directly, will actually help in cases like this. So I do think that we have other legislation that is more broad, that can cover more things at once, that will actually help what this situation was trying to help with.
Representative DeSimone.
Thank you, Mr. Chairman. To echo some of Representative Gregg's sentiments, we have both been working on a study committee to study definitions of certain issues that face families. So I think that rather than single out one particular issue, I would really rather work on issues that can encompass all parenting issues. Just because you have a mental health issue doesn't make you a person who should not have parenting rights. I know of a few people who have serious mental issues, and they are absolutely, thoroughly phenomenal parents. However, if they were not, the court would intervene and handle the situation to keep the kids in a safe environment. So that's why I seconded the motion.
Further discussion? Seeing none, the motion before us is ITL on House Bill 285. Moved by Representative Rice and seconded by Representative DeSimone. Will the clerk please call the roll?
Chairman Pearson,
Yes.
Representative DeSimone,
Yes.
Representative Rice,
Yes.
Representative McMahon,
Yes.
Representative Nelson,
Yes.
Representative Pettinel,
Yes.
Representative Love. Representative Corzine, yes. Representative Markel,
Yes.
Representative Gregg,
Yes.
Representative Levesque, Representative Rung,
Yes.
Representative Grund,
Yes.
Representative Raymond, Representative Georges,
Yes.
and Representative Malone.
Yes.
16-0.
14-0.
14-0.
You know what?
Consent. Did I burst your balloon?
Yes.
I'm sorry.
I was thinking about it all by myself. Any objections to consent? Good, thanks. Consent. Well, no. He did it first. Oh, you shall not remain nameless. This concludes the exec session on 285. We'll accept a blurb. Wow, through the miracle. Okay, we do have, I think we have one more. Have we done 560? No. So,
We're waiting on a.
we're not waiting, it's coming, but we're going to do something
Sounds good.
before then. Opening the exec session now on 560 relative to parental access to minor child's medical records. And Representative Corzine, did you have a motion?
I would like to motion OTP for
like to
HB
move?
560. I would like to
OTP.
move, sorry.
And who is seconding that? Why don't I have Representative Rice do that? Yeah, because you had your hand up. Now, discussion, because there will be an amendment coming from Representative Raymond. So why don't we hear from Representative Raymond?
Thank you, Mr. Chairman.
Welcome.
So my amendment is very minor. On page, well, it's only one page. On line 19C of the original, it says when a healthcare provider has determined by clear and convincing evidence based on articulable facts, etc. My amendment simply strikes clear and convincing, leaves evidence, and the rest of the sentence, because clear and convincing is not a part of the Child Protective Statute. So we should be aligning our calling DCYF in, or taking actions when we're concerned about abuse or neglect with the Child Protection Statute. And this is the language that kept the bill from passing the last couple times it's been up.
Chair would like to call on Representative Markle because clear and convincing and preponderance and oh boy, do we have the goods on you, and all of those are legal terms, and
Okay.
so we'd like to know a little bit about how line 19 of the original
Okay.
bill compares to what's being suggested here. So
Okay. Well, if you're dealing with the three standards of proof, the top one is a criminal standard. That's beyond a reasonable doubt. That is a very high hurdle to get over. Clear and convincing evidence is used very rarely in civil matters. You find it sometimes in contempt because of the possibility of incarceration. Well, it's true. And sometimes, for example, in other things like professional discipline. For example, in the case of an attorney who's called based on his conduct, the professional conduct committee has, before it brings dockets a case, for example, has to believe that there's a reasonable possibility that misconduct can be shown by clear and convincing evidence. Otherwise, it's a very rarely used standard. Preponderance of the evidence, which is basically 51% more likely than not, just get the ball over the net, is the more widely accepted standard. So that might be something you might want to consider.
So, as a lawyer who has dealt with these matters a lot, would you think that line 19 of the bill, as determined by clear and convincing evidence, should be amended as the Representative Raymond suggested, sir?
Let me just take a look right here. Okay, that's 493. Okay, yeah, I think it would be.
You think the amendment would be
Well,
preferable?
I would think you would probably need to align that and with what was said before. Yeah.
So under the Child Protecting Statute, which is RSA 169C, it says that if a mandated reporter has reasonable cause to suspect, that's the standard of proof by which they would contact DCYF.
Yeah, I would. Yeah.
So in this case, it
yeah.
would say when a healthcare provider has determined by evidence, and then I left the rest of it based upon articulable facts. So there's still there's still the requirement that the provider has to have a reason for it. It can't just be I have a funny feeling. It has to be
Right.
I'm articulating that the child has told me X,
Right.
or I'm saying that the child is covered in bruises, and if I do this, it could result in further harm.
That would be it. I'm not even sure that you really even need a standard of proof because that's a legal determination. And what you're doing here is looking at reporting abuse. Do I have that correct?
Well,
Okay, so if you're looking at reporting abuse, that's basically a discretionary judgment. And I don't know too many people outside, I don't know too many people who are going to be able to articulate exactly what clear and convincing evidence is. As a practical matter in the legal profession, I'll call it 75%. Okay. Preponderance of the evidence, 51%. Get the ball over the net more likely than not. So I would just say if they've got reason to believe, then that was what I would make it.
Right, which is what I would have made that, but someone had already put in the bill upon articulable fact, and I thought, well, I like that. I would like to make the minimum changes
Okay.
necessary
Okay.
to satisfy.
Well, then
the requirement.
articulable facts would make sense.
Yep.
Okay, so in other words, the answer is Dr. So-and-so or Mr. So-and-so, what led you to believe that you should make this report? Well, this leads me to conclude, there you go.
Yep. So in that case, I would like to move OTPA of my amendment.
Motion on the floor, and once again, the chair is a bit confused.
Oh.
Do we have to do 560 and then we vote the amendment?
You have to vote the
We
amendment
vote
first.
the amendment first. So, Representative Corzine and Rice, would you withdraw your motions temporarily, please?
Absolutely.
Thank you. Okay, now,
Oh, okay.
Representative Raymond, would you make a motion on your amendment, please?
Thank you. I would like to move that we adopt amendment 0673 to HB 560.
And a second, Representative Gregg. Well, we just heard the arguments. Anybody else have anything? Seeing nothing, the motion before us is moving amendment 0673 on House Bill 560. Call the roll, please.
Chairman Pearson,
Yes.
Representative DeSimone,
Yes.
Representative Rice,
Yes.
Representative McMahon,
Yes.
Representative Nelson,
Yes.
Representative Pettinel,
Yes.
Representative Corzine, yes. Representative Markel,
Yes.
Representative Gregg,
Yes.
Representative Levesque, oh, sorry.
It was good practice, though.
Yes, it was.
Yeah.
Representative Rung,
Yes.
Representative Grund,
Yes.
Representative Raymond, Representative Georges,
Yes.
and Representative Malone.
Yes.
14-0.
And now, we have a motion to be made for OTPA. And that had been Representative Corzine. You still have your blurb that can be tweaked?
I
Because
do.
we always need to say in the blurb, the amendment did such and such, and you can just add a sentence.
Sure.
So would you like to make that motion?
Absolutely.
Please, make that motion.
I make a motion to move HB 560 OTP.
No,
A.
A. Second was former chairman. Okay, good. There we go. Any further discussion? Hearing none. Clerk, call the roll, please. The motion is 560 as amended by 0673, moved by Representative Corzine, seconded by Representative Rice. Go.
Chairman Pearson.
Yes.
Representative DeSimone.
Yes.
Representative Rice.
Yes.
Representative McMahon.
Yes.
Representative Nelson.
Yes.
Representative Pettinel.
Yes.
Representative Corzine, yes. Representative Markle.
Yes.
Representative Gregg.
Yes.
Representative Rung.
Yes.
Representative Grund.
Yes.
Representative Raymond. Representative Georges.
Yes.
And Representative Malone.
Yes.
14-0. Now, would everybody please be quiet except Representative Gregg?
Would you like this on
I
consent?
would love one. Thank you. Any objections? Good. This concludes the exec session on House Bill 560. And we'll take a blurb to review and any other blurbs, one from Representative Rice when she gets a chance. Now, guess what? The team comes together as we often do on I open the exec session on House Bill 493, and you should have an amendment before you, 0715. Would somebody care to move this amendment? I thought so. And hey, guess what? The chair seconds it. Now, Representative Gregg, would you please speak to the amendment 0715 on House Bill 493?
Yes, after listening to testimony earlier, we decided that to add the entire section 2 here. So this is taking out the part that was just taking care of kids or, minors or whatever else. So that way we could include this and make sure that this is just part of the continuing education, because we do understand how important it is to get this child abuse education out there.
And you have also
And
changed
require it.
in line 5 to put this all under continuing medical education.
Yes.
That came up too.
I forgot about that part too. Yes, we changed the statute. But I do think that it is important too, because this language has been out there, even though, I understand with the medical association, they would like to handle this. Unfortunately, we've not seen them moving to do that at a great number that I would like to see. So I think based on the successful implementation of legislation on this in other states, I think that this is the right step for New Hampshire.
And to my point about how this could open the floodgates to all kinds of people wanting an hour for this and an hour for that, I am persuaded that child abuse, being such a very important topic and such a widespread thing, would not necessarily open the floodgates. That we could say to people coming with other things that happens once in a million times, I'm sorry, this does not rise to the level of that. So I am in effect withdrawing my objection here and saying how much I appreciate how the team, as we often do, came together. Anybody else? Oh, Representative Nelson.
Thank you, Mr. Chairman. And thank you for that. Thank you for being open. I really appreciate it very much. It means a lot to me. Last year, when this bill was heard, I'm going to get choked up. I really can't barely talk about this. There was a doctor who, who testified about non-ambulatory infants who had been seen with bruising and then came back either dead or will live in a vegetative state for the rest of their lives. And I just could not shake that. And so I'm really glad that we were able to come to a compromise on this. And again, thank you, Mr. Chairman, for your willingness to be open.
Representative Petitno, we can go home to our spouses tonight and say, honey, we have not added one more hour to your burden. Do you wish to speak?
Yes, thank you. I just would like to clarify. Thank you, Mr. Chairman. This is now would apply to all physicians regardless of what age. Thank you.
Old physicians, young physicians, yeah. Depending on age, no. Representative DeSimone.
Thank you, Mr. Chairman. I think that what concerned me was when one of the physicians testified today, and in the beginning of his testimony stated that there are many physicians who notice things, but they're so rushed they don't want to stop and take the time. Well, maybe if they had this education, they would understand that it is integral to the life of a child that they stop and take the time. Even though they are already mandated reporters, they need to learn how to stop and take the time. I get that they're rushed. I get that they're busy. I bless them all. So that's why I'm happy to vote for this.
I had a rather naughty thought here. At the medical center I supervise, if the patient needs 26 minutes and the insurance reimburses for 15, the patient gets 26 minutes. And for those doctors, and I know many of them, who are told you will spend 15 minutes, then go to the next room, I can see a rebuttal here to being rushed along when they see clear and present danger signs here that said, yes, I spent 18 minutes. Do you wish to discipline me? Bring it on. So, you know, I am very fed up with the state of medical as the insurance companies have hijacked it. So I don't think I need to make that as in a form of a motion. I think that's acclamation. Anyone else? Yes, Representative Corzine.
Thank you, Mr. Chairman. That's not what I got from the story. I got that the physician wrote it down knowing he was seeing abuse but didn't want to get involved. And to me, that's a whole nother can of
That is a
worms
different
that
thing,
needs to be dealt with.
That is different. I think it's also a valid point. Yeah. Anyone else? Representative Rung.
Thank you, Mr. Chairman. The other thing that becomes clearer with this amendment is that because it applies to all physicians, not those who just treat patients under the age of 18, is that it may help physicians who may not be seeing that the victim of child abuse to be able to recognize that it may exist because of how they may be treating a parent or a sibling or a caregiver. So I think having all physicians more aware of the reporting and signs of child abuse, it may help children who that particular physician may not be seeing, or that nurse practitioner or physician's
That's an excellent point. I've just asked the clerk to make sure that's been put in the minutes. That's
Oh,
a
well,
very
thank
good
you.
point. Anybody else? Okay, the motion before us, I believe, is the amendment 0715, moved by Representative Gregg, seconded by the chair. Would the clerk please call the roll?
Chairman Pearson.
Yes.
Representative DeSimone.
Yes.
Representative Rice.
Yes.
Representative McMahon.
Yes.
Representative Nelson.
Yes.
Representative Peternell.
Yes.
Representative Corzine. Yes. Representative Markel.
Yes.
Representative Gregg.
Yes.
Representative Rung.
Yes.
Representative Grund.
Yes.
Representative Raymond. Yes. Representative Georges.
Yes.
Representative Malone.
Yes.
14-0.
Now, for your continuing education, why did Representative Gregg not ask if this should go on consent? Representative Rung for the answer.
Because it was only a vote on the amendment, not OTPA.
Brilliant. Now, who wants to make the motion and write the blurb and defend at all costs an OTPA? Well, you know, if there was somebody who was way more enthusiastic, I would pick on them. And you're going to do what?
No, I will try to be second, but you're already going.
Okay, we passed the love around. You know that. Representative Rice moves, and Representative Georges.
Gorgeous.
Still jealous of the hair. Still jealous. And the motion before us is OTPA on House Bill 493 as amended by 0715, moved by Rice, seconded by Georges. And the clerk may call the roll, please.
Chairman Pearson.
Yes.
Representative DeSimone.
Yes.
Representative Rice.
Yes.
Representative McMahon.
Yes.
Representative Nelson.
Yes.
Representative Peternell.
Yes.
Representative Corzine. Yes. Representative Markel.
Yes.
Representative Gregg.
Yes.
Representative Rung.
Yes.
Representative Grund.
Yes.
Representative Raymond. Yes. Representative Georges.
Yes.
Representative Malone.
Yes.
14-0.
Would I like to do what now? Oh, consent. Yeah. Okay. All right. Thank you. Any objection? Of course not. And I just want to say to Representatives Grund and Rung and Peternell, you're welcome anytime, and you can even sit up here, but you got to make somebody sick to do it. So thank you for coming. We so enjoyed you, and we're the fun kids.
I hate to,
What?
to change it, but maybe it would be better if you make somebody go on vacation.
Oh, okay. Oh, I also have to conclude the exec session on 493. Remember, no school next Tuesday. And we finish up 2 weeks from now. And so be ready, be happy. And we are done. Thank you.
Does anybody need a committee report?